Welcome everybody to the Joint Committee on Child Welfare Systems Oversight. Today, Friday, March 15th, 2024. I'd like to welcome Representative McDonald, who is filling in today for Representative Ruiz. And I'm so proud of the senators that came because I was listening to you on the floor last night while I was in bed. So I don't know what time you finished, 10 o'clock. So thanks for being here. And then we have a couple more senators that are joining us online. So both Senator Erickson and Senator Baumgardner are attending the meeting. We want to jump right into some programming here. We have with us Dr. Sanders from the Casey Family Programs, and he's going to have to catch a plane later today. So we want to jump right in. I'm just going to read directly off of some introduction material that I have because it states it a lot better than I would. Casey Family Programs is based in Seattle, Washington. It's the nation's largest operating foundation focused on safely reducing the number, the need for foster care and building families of hope for children and families across the country. Casey Family Programs was founded in 1966 as a provider of foster care services, working directly with children and families. So that's who Casey is, and Dr. Sanders, I'm going to read his intro as well, but I just want to tell you, I heard him last summer at CSG, and he just really spoke to me at that time. And I just thought it would be very important for all of you to hear directly from him. And so happy that he was able to be here in person. We've been working on this for several months. So very excited about it. So David Sanders oversees the Casey Family Programs work with child welfare systems to improve practice, with an emphasis on ensuring safe and permanent families for children. He also oversees the foundation's public policy and research work. In addition, President Obama appointed him chair of the Federal Commission to eliminate child abuse and neglect fatalities. Prior to joining Casey Family Programs, he directed all operations for the Los Angeles County Department of Children and Family Services. So at this time, I'll ask Dr. Sanders to come to the podium and welcome. And I'm sorry, you guys, my voice sounds like I just rolled out of bed, but I have sounded like this for this entire week. I feel fine, but my voice sounds like somebody poured a sand pit down my throat. Okay, are you ready? Okay, welcome.
David Sanders, and I am Executive Vice President at Casey Family Programs. And thanks for the very generous introduction. So today, I'm going to try and cover 4 or 5 different areas. I'll talk a little more about my background, particularly as it's relevant to this issue, so you can get a sense of my perspective on this. I have some questions for all of you that hopefully you'll at least think about after this presentation. We'll spend most of the time talking about what should you expect of the Child Protection Agency. How is your agency performing, and what you can do as legislators? And also offer some thoughts on why this is so hard and how to overcome some of the challenges. So the goal today really is to make sure that you have some additional ideas about how to oversee the agency, what your role as legislators can be, and particularly by better understanding the data. But before I go into my presentation, I want to commend a couple of people. First, Laura Howard. She has what I consider to be the most difficult and perhaps the most important job in the public sector. People accept that government's responsibility is to keep children safe, that government is responsible for keeping citizens safe, and there's no more important endeavor than child protection in that. She and her staff make dozens of life and death decisions every day. Those decisions are easier in hindsight than in real time. And I could go on and on with the challenges she faces, but it's often a thankless job. And I want to start by acknowledging her and thanking her and recognizing the role and the critical role she plays in establishing and articulating the vision and direction for the child welfare system. I also want to recognize Representative Concanon for her long history and long leadership on this issue. It's especially commendable that you've continually sought ways to improve this system where feasible, learning from others. Child protection is not so much a service as a civil enforcement function with the responsibility of assuring children in this state are raised with certain safeguards. And the legislature determines a framework within which everybody is expected to act. Your leadership in keeping an eye on children and families is commendable. I have a lot of ideas that I'll present, but I don't know the state of Kansas. You two do, and you'll provide many of the answers as we move forward from today. So first, my background, and as Representative Concanon mentioned, I am a vice president at Casey Family Programs, and Casey focuses on foster care, the largest foundation in the country that does exclusively on foster care. Prior to that, I worked as a child welfare director for 14 years in Hennepin County, which is Minneapolis and suburbs, and in Los Angeles County, and really will present my view from all three experiences. Within Casey Family Programs, as mentioned, and I'll talk a little about this, I chaired the Commission to Eliminate Child Abuse and Neglect Fatalities, which was a congressionally created commission in the early 2010s, and ended up with a report really talking about what needs to happen to reduce fatalities in the child protection system. I've also served on several commissions at a local level, including Philadelphia and Los Angeles, to oversee their work. And so I'm familiar with the oversight responsibilities, certainly that commissions have. So now let me actually ask you a couple of questions before I go into the presentation. I can figure out which of these. Okay, great. Thanks. So first, really, and because this is a key question, how many of you on the committee feel your state's child protection agency is performing well? You don't have to answer it, but it's certainly something that you have to think about as we go into this presentation. Second, if your agency isn't performing well, how many feel the agency is improving? And third, it's really critical to be able to think of legislative actions that you've personally been involved in that you see as either promising or successful. And those are things I'm going to come back to as themes as we go throughout the presentation. And fourth, I'm really curious because the importance of relationships. I hope all of you have an opportunity to meet regularly with individuals in your child protection agency. And for those of you who perhaps and be offered the opportunity, have been offered the opportunity, hopefully, to ride with social workers as they go out to do investigations, to meet with the leadership, to hear about the vision. I think all of those are important to make improvements. I'm going to talk a little now about what I know about your system based on data. And I'm going to also point out some basic structural flaws that challenge the performance of every state. I'll likely be somewhat provocative in some points, and I guarantee that I don't know your state as well as you do. So there are things that I will say that'll be wrong. But I do have the perspective nationally that hopefully I can offer in putting things into some context. So first, I really try and make this very complex system simple. The way I see it, child protection is a public system accountable to the public, who are represented by you, and to the children and families being served. In my experience, there are two things the public is concerned about. First, If children are harmed and they come to the attention of the agency, they shouldn't be harmed again. That's a bottom line expectation, that we, the public, are paying you to make sure that children are safe, and you need to assure that that happens. Second, in my experience, the public is concerned about children languishing in care. So safety and permanency are the cornerstones of this system. But let me shift it back just a little further. What's the purpose of the Child Protection Agency? Well, first, it's important for me to define what a Child Protection Agency is. That oftentimes, the way it's approached is that the Child Protection Agency is actually the broader child welfare system. That's not true. The Child Protection Agency is the agency that's responsible for taking reports of abuse or neglect, determining whether they have occurred or not, and providing services to children and families. Those services are generally related to the ability long term for the children to stay with their parents or not. It's a very narrow piece of the child welfare system. The Child Protection Agency can't do its job without mental health services for children and families, without substance abuse services, without housing, without domestic violence services, without law enforcement, without the courts. It is a broad system that child protection is only one piece of. And oftentimes, the agency is given responsibility for things that other parts of the system should be doing. It's not possible to improve the Child Protection Agency performance without attending to the child welfare system. In the Child Protection Agency, children are identified as potentially unsafe, and there are essentially standards for parenting that are identified in statute. Not only is the Child Protection Agency responsible for upholding those standards, really enforcing those standards, but so are the courts, and so is law enforcement. And it varies to different degrees in different states, but both have critical roles. The Child Protection Agency uses a system of mandated reporting, hotlines, and child protection investigations to determine who's been abused or neglected. And I'm going to come back and talk a little about those because each of them has some apparent flaws if we look at measures across the country. In addition, the agency has the responsibility to treat children, including placement, and or to find new permanent families as needed. But the two questions that matter the most, regardless of how complex the system is are children safe and do they have permanent families? Well, let me actually answer the second question first. Foster care is by definition a temporary situation. It is a respite for children who will be hurt if they remain in the care of their parents or whoever their primary caregiver is. It's a vital support for children in this state, but to the extent children spend one day longer than necessary in foster care, the answer to that second question is no. Family is permanent. Foster care is not. I'm unaware of any reason from a child development perspective, from a child well-being perspective, from a research perspective, or from a legal perspective, that children should spend more than 2 years in care, in temporary foster care. If they need a new permanent family, that decision needs to be made and they need to move permanently. But to remain in temporary foster care for longer than 2 years is contrary to everything that I'm aware of related to child well-being. So if we look at over 6,000 children in care, and about probably 30% of those for longer than a couple of years, I think the question of do children have permanency is answered in some ways, and I'm going to come back to that. Are children in your state safe as a result of your child protection agency's existence? Then is a question that you have to answer. And partly that question is determined by how do you define safety? The child protection definition of safety really, which is in federal statute, is that children have to be abused first before services are offered. An investigation doesn't occur unless there's suspicion of abuse or neglect. I don't know that that would be the definition that most of us would give of safety for children. I think most of us would say safety is freedom from abuse or neglect in the first place. The Child Protection Agency is reactive. It can't be accountable for preventing abuse unless you specifically created a prevention focus and statute. So let's look at how you're doing regarding safety. There aren't really good measures of safety. So these are the best out there. And first is recurrence of maltreatment. And this is really quite impressive that this is what Kansas is doing compared to the rate nationally. And so far fewer children are abused after they've been identified as initially abused in Kansas than is the number across the country. Now, that in and of itself doesn't mean anything because you have to define, each state defines safety differently. And so if your definition is broader or narrower, it could impact this number. In addition, the way that states handle hotlines and investigations is different. But this gives at least some sense of where you might be starting and what some of the things you need to think about are. And a second measure is, you can go to the next one, is reentry into care. And this is children who go into care, go back home, and then come back into care. And Kansas, compared to the rest of the country, has done well, although it has been more varied in the last few years. But again, it gives you a sense of where you might start in terms of the kind of efforts that you want to make in your oversight role. And the next is probably one that is, you can go to the next slide. I could go back, I'm sorry. So this is child abuse and neglect fatalities. And this is fatalities per, I believe it's 100,000 children or 10,000 children. And no matter how you look at this is perhaps the most important thing that the public is concerned about, because this is the most obvious situation where a child has been seen by the Child Protection Agency and then ends up seriously injured or killed. Now, not all of these children are actually seen by the Child Protection Agency, and it's difficult to say how many of them were based on the data. But the Federal Commission found that about half of the children who are killed at the hands of their parents or caregivers have been seen before by the Child Protection Agency. One thing I would say, though, to kind of bolster what I said earlier about the importance of a child well-being system and everybody's role in that, is that while about 50% of children are seen by the Child Protection Agency, over 90% are seen by a primary care physician. So the role that physicians play is absolutely critical in this. I don't want to get off of the agency focus, but it is a reminder of how everybody plays such an important role in this. The second issue that the public is concerned about is our children with caring family. So let's look at the permanency data. So this is a measure that really looks at the permanency within 2 years. So for a child coming into care, do they achieve permanency within 2 years? And this is a fairly straightforward measure. It's a lot more complicated than it appears on the screen. But this is an area that it does look, compared nationally, that Kansas is not doing as well. And both nationally and at a state level, the percentages have declined. So fewer children entering care are achieving permanency within 2 years. And in fact, that number is close to 30% in Kansas. And that's one of the questions that you'll have to ask is this an area that you want to focus on? Because I would suggest that the length of time that children spend in care is one of the greatest variables in terms of looking at how children are doing. The longer children spend in care, the worse they tend to do, whether it's high school graduation rates, whether it's re-abuse, re-neglect, and so forth. And so this is an important measure. And This is permanency for long stayers. So the first one was for children who've been in care for 2 years or longer. So this is a group that doesn't achieve permanency within 2 years. What happens to them within 12 months? And you can see that nationally Kansas fares well, but the percentage is still fairly low. If you go into care, 70% of children are still in care after 2 years. And then after an additional year, another 65% of the remaining children are still in care. And so that's an area that I think that, at least for me, the measures really speak to, and I think will be important to take a look at. There's a handful of other measures that are just important to provide some context. Go to the next slide. This is the screened in. So what this means is the calls that come into the agency, what percentage of those are screened in, meaning that they will receive an investigation. And you can see that nationally, the percentage who are screened out. In other words, let's say a physician calls in to the hotline, almost 40% of calls are screened out, so they don't receive any investigation nationally. That number is lower for Kansas, and I think again the question is, what do you want for your system? Because it's an important measure. If I, as my background is actually as a psychologist, so I was a mandated reporter. If I call into the hotline and there's no response at all, I've damaged a relationship that I have with somebody potentially, and it's all been for very little. And the other thing is that the motivations for calling in really vary. We like to think that they are all very positive because somebody's concerned about a child's safety, but the reality is that's not the case. Is that people call for a variety of reasons. Some call because they believe it's a way for families to get support and resources. Some call because they are being vindictive and they have had a fight with the family. There are all sorts of reasons that people call, and this is an important piece of information for the oversight of the work in Kansas. The second, go to the next slide. The and this is the substantiated rate. So of the calls that are investigated, this is the percentage that, or the actually this is measured in rate, but this really gives a sense of how many of those calls are that are responded to actually turn out to be potential abuse or neglect. And what you'll find is that it's actually a relatively low percentage. And one of the things that we learned, for example, during the pandemic, where there was a lot of concern that education wasn't seeing children, is that when we started to look nationally, and I don't have the numbers for Kansas in front of me, but when we started to look nationally, education is the biggest referrer to child protection. But in terms of actual findings of abuse or neglect, the percentage is very low, less than 10%. And what this reflects is that of the hundreds and thousands of calls that come in, actually very few turn out to be abuse or neglect. This is important as you consider what you need to do to support improvements in the system. And I will talk about this quite a bit later, but the idea that resources are devoted to, first of all, taking calls that don't turn out to be child protection reports and investigating a large number of complaints that, in fact, don't turn out to be substantiated means that resources that could be going to families that truly need those services are not going to them. And that's one of the reasons why systems are so overwhelmed, because the net is so wide for calling people in and so narrow for bringing people in that the agency is really devoting most of their resources towards investigating families, taking calls, and determining whether things are screened in or screened out. This is where Kansas also, it's an interesting phenomena that I think you'll have to, this is another area that might be one you want to take a look at. And this is the rate of children in care. And so while Kansas has fewer kids substantiated, so a lower percentage where there's a finding of abuse or neglect, more children are going into care in Kansas, and that may be good. It may be something that you want to see. It may not be, but I think it is factual in terms of the rate compared to the rate nationally, and so it could be because The complaints reported are more serious, the ones that are found. It could be because there's a lower standard for placement. It could be for any variety of reasons. But this is an important piece of information to know because it really does. This is the most intensive intervention that child protection has. And if it's being used regularly, it's important to know what the reasons are. And this is the rate in care. The last one was entering. This is in care, and again, it is quite a bit higher than the national number. So even though the numbers here have gone down, the number of children in foster care has declined over the last few years. This number of the rate of children in care is still higher than where things are nationally. Again, that's a judgment that you have to make, but it's an important role for the oversight committee to be able to think about how are the most intensive services being used, especially when you see children in care for as long as they are. And this last one is we look at the rate that children are entering care versus leaving care, because what it gives is a sense of the children should leave care with a family and should leave care unquestionably with the family. This is a measure of how many children are not leaving care with the family versus how many are coming into care. And if you have more children coming into care than leaving, you're going to have a growing caseload. And you have to wonder, is the agency providing the kind of supports necessary? If not, if you have more children exiting than entering, you'll likely have a declining caseload, and you can begin to look at some of the positives that are happening to assure that children are reaching families. And Kansas has improved in this area. There's been improvement nationally, and this is something, again, that can be a tool for the Oversight Committee to take a look at. So, what does all this mean? Well, what I would say, it's imperative that you have a collective sense of what success looks like and what failure looks like. What exactly do you expect of your child protection agency? Now, I would be the first to say that I would love if every agency could be perfect. Perfection is probably unattainable. It makes sense to strive for it, but probably won't be accomplished. My guess is that nobody here does not want to see children safe and with permanent caring families. Are you measuring that question? Do you know how it's going to happen? Do you know what it'll take? How far are you away from the goals that you have? Those are the oversight responsibilities that I believe you have as a legislative body. You need a clear vision of where you want to go. You need to measure your progress. You need to know whether you're improving or not. There's tremendous information to be gathered case by case, no question about it, and anecdotally. But unless you're able to measure whether you are improving or not, it's unlikely that you'll be able to translate those anecdotes into system change. So if I were to ask you, who's the best team in the National Football League? You can tell me, and you would be loud about it probably. But you would also have evidence in the forms of wins and losses to demonstrate to me why that's the case. It's no different in the oversight of your child protection agency. There's factual measures that you can attain to really look at, are you moving in the direction that you need to and that you want to? So let me switch a bit to a little more about what you can do. So these are just my thoughts. These are not necessary. There's no kind of science behind this. I think this is experience and observation. There are really four different, very different reasons that agencies are perceived as failing. I would not necessarily say they are failing, but I intentionally use the term perceived to be. One is that the agency is really full of heartless bureaucrats, and the public doesn't have confidence that the agency cares about children, that the public believes that the agency cares about money, cares about their own staff, cares about how things look, but aren't concerned about kids. The second is that there hasn't been a definition of success. It's really difficult if there's a differing assessment of what success looks like. In some cases, for example, and I'm certainly aware of these, and I know they've happened here, that let's say there's a child fatality. The agency may feel that they did everything that they could have. The media and the public may feel there are different things that could have been done. But if success isn't defined and if failure isn't defined, then it's really difficult to assess that. But oftentimes, the lack of definition of success leaves the agency in a position where they are harshly criticized regardless of what they do and rarely praised for anything that they do. Third, and I haven't talked about this as much, is the lack of focus. I've touched on it some, but it really pertains to the child welfare system versus the child protection agency. If you want to improve safety for children, you have to create a structure where the child protection agency works with those children who are at imminent risk of harm. Now, it could be different in Kansas, but if I ask workers, certainly the jurisdictions I was part of, or ask workers now where they spend their time, they will say they spend their time with 14-year-olds, 15-year-olds, and 16-year-olds who are running away from their families, and they're looking for homes for them. That's how they're spending their time. The data is overwhelming that the children at the greatest risk of child fatality or serious injury are birth to 5. Over 80% of children who die at the hands of their caregivers are birth to 5. But if you ask most workers where they spend their time, that's not going to be where they spend their time. So, to improve safety, if the agency is distracted because it's working on other things, is going to be very challenging. Well, as I said earlier, only 10% of calls receive ongoing services. And again, that is an issue of focus. And to what extent is the agency working with the children who are at the greatest risk of being harmed? Finally, there is the question of performance. It's not true that every outcome, every bad outcome, is the responsibility of the Child Protection Agency. Sometimes it is. But part of your oversight task is to distinguish between good and poor performance, because it's very different for a child fatality to occur in an organization whose performance is deteriorating than an organization whose performance is improving. You probably want to focus on different things. If improvement is being made, then maybe you don't want to change everything. If improvement is not being made, if the organization is deteriorating, you really do want to look at, let's make some major change here. But it's important to be able to make that distinction. And the only way you can do that is to know how the organization is performing overall. So what can you do? First, I think, is really to create clear measures of success that all can see. And one of the questions within that is, who should the agency focus on? And I'm speculating here, but most agencies do focus on older youth. And the question is, how do you balance the needs of older youth, for example, coming from the juvenile justice system, with infants who who are at by far the greatest risk of future harm? Do you have the same policies for 3-year-olds as you do for 17-year-olds? If you look at licensing, if you look at visiting, if you look at other issues related to that, the policies tend to be very similar, even though the risk is much higher for younger children. The question that you really have to ask. In addition, if you look at both length of time in care as well as relationship, for example, with kin, are there differences between an infant and a 10-year-old? If those differences aren't reflected in a positive way in statute or in the structure that the agency is working within, it may be difficult to achieve the kinds of goals that would suggest that children's conditions are improving. So one is to really create those clear measures of success. And I would also say it's important for there to be open communication. The agency has to feel and has to be able to come forward and say, we're doing well in this and we're doing poorly in this. And that has to be a conversation. You have to have information to carry out your oversight function. And that really is a responsibility that the agency carries. Second, I would say, is to make sure this is remaining as simple as possible. That there are a lot of ways to kind of obfuscate the information that comes forward. But we want children to be safe. There are ways of measuring safety. We want children to be in permanent homes. We want to use foster care as a temporary respite. And when those things don't happen, we want to develop plans to make sure that they do. The children who've been in care for 2 years or longer without permanency is a group that you're probably struggling with to find placements for. They're the ones who are often identified as staying in hospitals for too long. They end up not having homes that can be found or kicked out of homes. Building or finding more temporary placements for them, to me, is not likely to be successful. They need permanency, and every child that the agency says can't remain with their family, the agency and the courts, they can't remain with their family, either needs to have that family functioning improved quickly so the children can return home, or needs to move to a new permanent home. Remaining in foster care is simply not an adequate solution. That's the goal and responsibility of child protection. In addition, again, while oftentimes much time is being spent keeping 16 and 17-year-olds from their families, because when they run, they're often running to their families, more often than not, they end up there at age 18. But they end up there with no preparation. So they've been running saying, we're going to go back to our family. We do everything to keep them in care. And then they go back to their family at age 18 with no plan. We demonstrate over and over that we have nothing better to offer. We know that they're no longer at risk of harm, but we continue to do the same thing over and over. That's something that I think the committee has to really think through. And what do you want in Kansas? I mean, a couple of other things that you can do. One is I believe this has happened to some extent, but it's important because it is a public system to make data public. The public should know how the agency is performing in very simple ways, and that should be reflected in the exchange of information between the executive branch and the legislative branch. For example, the idea of requesting reports on long stayers with specific plans to get them to home seems to be something that would be the kind of information that should be shared with the legislature, available to you to really determine, so what do we need to do with children who've been in care for 2 years or longer? Getting frequent reports on the numbers, for example, some of the things that I showed, are important. There should be a regular report that comes to you that really looks at how the agency is doing. And the agency, I'm certain, uses information to make improvements. So, what do they use? How do they do it? What are they doing exceptionally well? The safety numbers are impressive. So, it's not just oversight of what's not working, but oversight of what's working. And how do you expand that? The next area that I'll spend a little more time on is the front door. And that's the hotlines and mandated reporting and investigation. So you can go to that slide. Thank you. This is true across the country, that the percentage of children who actually receive services is quite low, given all the calls that come in. Most of your staff time is devoted to investigations. Very few families receive services. However, while this is critical information, and I think it's, go to the next slide. Go to the next. So this is a piece that we've spent a lot of time talking about at Casey Family Programs and examining and talking to jurisdictions. And that is the definition of neglect. And I'm not going to get way into the weeds on this, but I want to talk a little about it because again, it's the responsibility of the legislature to really define who it is that's served by the child protection system. So what we have found is that most states use the federal definition for sexual abuse, for physical abuse, and there's very little variation. Neglect, there are over 50 definitions that states use of different types of neglect. And in some situations, I would argue that neglect is as serious as the most serious physical abuse. As many children die due to neglect as due to physical abuse. It can be extremely serious. So it's not a matter of seriousness, but it is a matter of, is this the intention of your child protection system? Because in many of these situations, what is what is most confusing is that for families, it's a lack of resources. They don't provide something for their child, not because they're unable to or unwilling to, but because they don't have the resources. And the question again is, do you want your child protection agency providing services in those situations? This is an area that is really ripe for oversight. I think that the agency can provide information, but in most states, and I'm not sure again here, I don't have the numbers right in front of me, but in most states, only about a quarter of the children who come into the investigation, actually, it's only about 10 to 12% receive services. And so, given that you have that percentage receiving services, 80% end up of the children in placement are in placement because of neglect. So most of your resources are going to children and families where neglect is the definition. That is the finding. And if that's where you want your child protection agency to be, then really make sure that that's clear. If not, then that's work that you have to do, I think, with the agency. What we found is that it's really difficult to determine what neglect is and what a lack of resources is. And while it might be clear in some states and statute, if you're a 24-year-old worker and you're going out to investigate and you go into a home and it looks the same, how can you distinguish, is it poverty or is it neglect? Now, some states have done exclusions for different reasons so that you can be a little clear about which is what, but it's a very difficult situation. And again, I think ready for some oversight and strong consideration of, do you have the, are you serving the families that you want to, and are you devoting your resources to those children who need them the most? And and I think part of it is that for me, if I move from one state to another, and let's say I have diabetes, I should have diabetes if I move to Utah from Kansas and vice versa. But that's not true of our child protection system. And so I think the question is, for you and for the citizens of Kansas, do you want to serve a large number of kids and perhaps not distinguish between those who are most seriously at risk, or do you want to serve a smaller number of children? Again, those are decisions that the legislature really makes through legislation. The, the last thing that I would add in is some conversation about the commission and my mention of the Commission to Eliminate Child Abuse and Neglect Fatalities. So the commission concluded that we can't eliminate, or probably not even reduce, child abuse and neglect fatalities because of our approach. The approach is completely reactive. We don't use information that we could use to, to make decisions. So, unfortunately, tragedies like have happened here over the last few months are tragedies that continue to happen. the number of children who die due to abuse or neglect has drifted up slowly over the last 20 years. The Commission believed that child abuse and neglect should be viewed more like a public health issue. An intervention that waits until children are at a minimum abused or neglected, and in some cases tortured or maimed before intervening, will not work. It's contrary to everything we know. We have a good idea of who's at risk for later abuse and neglect. We have a good idea of some of the things that work. We also, through Family First, are learning some things with the approach of the community pathways. One of the criticisms of Family First was that the initial premise was that in order to receive preventive services, it was necessary for the child to be assessed by the Child Protection Agency. That keeps us in the same paradigm of children can only be safe after they've already been hurt. So states began arguing that you don't need an individual assessment of a child. You can look at the history of the agency to determine who's at high risk for placement. And you can offer supports to make sure that those individuals, communities, and neighborhoods are not impacted the way that they have been. That rather than getting services through child protection, the services can be through communities, through those agencies that they trust, and through others that are offering support to families that are at the highest risk. So I think as I close, I would just say real opportunity in taking a look at how successful the agency has been in different areas, how to build on that success, how to look at the number of children being served. Are they the children that you would want served in the Child Protection Agency? Are you getting the outcomes that you want as it relates to permanency for children, particularly? If it were your own children, would 2 years in limbo be okay? Probably not. It's probably not okay with these children. I think reviewing your definition of neglect, looking at what can be done to strengthen the partnerships, particularly with physicians. I would also, I can talk a lot about it, I won't now, but it's equally important to think about the relationship with law enforcement and law enforcement's role in all of this. And I think finally, to identify and publicize measures by which your agency is assessed, to assure success is defined, to assure that failure is defined, and that communication occurs across agencies and across branches of government. So I'm going to stop there and open up for any questions.
Okay, thank you. That's a lot to take in this morning. Committee, do you have questions? Representative O'Shea. Oh, sorry, Senator O'Shea. I have to readjust.
Thank you, Madam Chair. No worries. Thank you so much. This has been wonderful. I'm looking at the slide about types of neglect included in state statutes, and I'm not sure if this is for you or for our staff in terms of which ones do Kansas include out of that list. I'd be really curious.
So we've asked this question of our revisor in the past, and she has a definition that we use in Kansas for neglect. So go ahead, Jesse.
Yes, thank you, Madam Chair. So in Kansas, under 382202, child in need of care means a person that is less than 18 years of age at the time of filing the petition, who, and this is the list of kind of those determining factors that are used by the court, is without adequate parental control, care, or substance, and the condition is not due solely to the lack of financial means of the child's parent or other custodian. So when the doctor's talking about kind of that financial aspect of poverty or whatnot, this is the only part in state statute that says that makes any sort of differentiation on the financial means. So that's the first one. Then 2 is without care or control necessary for the child's physical, mental, or emotional health, has been physically, mentally, or emotionally abused or neglected or sexually abused, has been placed for care or adoption in violation of the law, has been abandoned or does not have a known living parent, is not attending school 7, except in the case of a violation of some statutes that I don't know exactly what they are, does an act in which is a person committed. So one of the statutes is has been purchase or consumption of alcoholic beverages underage, or other prohibited acts. This one talks about financial aspects, financial interests. And then next would be, while less than 10 years of age, commits any act, if done by an adult, would constitute the commission of a felony or a misdemeanor, who is willfully and voluntarily absent from the child's home without the consent of the child's parent or other custodian. So that would be kind of a runaway situation. There are 14 of these, so this is why this is so long.
I'm sorry, Jesse, could you tell us again what the number of the statute is?
Oh, yes. So it's 382202. And it's under subsection D, and then D has 1 through 14.
Okay. I'm not finding it. I mean, I'm finding a different definition. Yeah, I mean, this is chapter 38. Sorry, I'm just trying to read along with you, and I'm having trouble finding it.
Yeah. So it's 382202. So. Subsection D.
Okay. All right. Okay. And what if I may, what about 38-2202A definition? Then it says see reviser's note, but subsection T has a definition of neglect with then 1 through 3. But that's not, I don't think that's where you're reading from, and I'm
yes. So
I don't know what the difference between A and not A or
Yeah, so 382202 and then 382202A is kind of this issue that occurred last session, where 2202A was passed after amendments to 2202. So 2202 is a statute that kind of has the new definitions related to child abuse review and exams that was passed out. And then the 2202A does not include those amendments. Instead, it includes that behavioral health crisis, which was amended into that statute related to House Bill 2021. So between those two statutes, the definition of a child in need of care should not be different. But yes, the both statutes further define neglect. And so I'm not reading from the definition of neglect. I'm reading from the definition of child in need of care, which lists the factors for that.
Okay, you're really good with organizing these. So we just may need to do some work on that sometime, because you've done that before. So thank you.
So for example, the revisor's office, if there's any bill that's passed that will amend this, then we'll reconcile those two. So then we no longer have that 2202, 2202A difference. And then that would also be compiled in a reconciliation bill if there is no substantial amendment done to 2202.
Thank you. I'm sorry for interrupting, but I just was confused about the two different definitions.
Well,
thank you.
and that's why I handed out these new sync code books,
Good.
so we can look it up. Okay. Are we back with Jesse? Are you?
There's just a few more factors left.
Okay, go ahead.
And so one of them is while less than 10 years of age commits an offense defined in 6301, which is a criminal use of weapons, has a permanent custodian appointed, and the permanent custodian is no longer able or willing to serve, or then lastly has been subjected to an act that would constitute human trafficking or aggravated human trafficking.
Okay. They're right there behind me. So we have a pretty extensive definition of neglect, obviously. Yeah.
Senator O'Shea.
Thank you. Just as a follow-up, was we were kind of going along looking at this slide. It looks like we have most of these definitions, if not maybe more. That's kind of what I wanted to compare to. Thank you.
Oh, from his slide.
Yes, from
Yes.
slides about what types of other states have this definition of neglect. Ours is pretty broad.
Yeah, pretty broad.
Were you wondering what other states might, or just making the observation?
I wanted to compare Kansas to these definitions and where we might lie with if we also included these definitions.
Okay. Senator Holscher is online, and I forgot to mention her earlier. She's joining us online, and she has a question.
Oh, thank you so much. And I am leaving my camera off because I didn't get home until close to midnight and I look tired. So bear with me. Thank you, Doctor, for being here. I was looking at the slide that shows rates substantiated. And it looks like Kansas is a bit lower than the national average. And I know at that point you were talking about, maybe we devote too much time to investigation. However, I would say that I feel like the public perception is that we miss valid cases. So, do you have thoughts there as far as maybe potentially something that we are missing? Like, are our valid cases, are we missing something there because our numbers are lower, or should we really be looking at directing manpower and energy elsewhere?
Great question, and I just have observations. I don't know this for sure at all, but I think that there's actually several reasons why situations are missed as part of an investigation. And I'm not sure that it's necessarily connected to the number that come into the agency. Part of it is, but part of it isn't. So I'll be specific. If a physician who's been serving a family for 10 years suspects abuse or neglect, their responsibility is to report that to the agency. And often the agency then excludes the physician as part of the decision making because they are required to in many cases. They're the ones making the decision. But the physician may have information that's very difficult to translate purely in writing. And if they were working with a child protection worker, might actually have a much more accurate picture of what's happening with the family. But that's not part of what happens in most states. I mean, it may happen here. I suspect it's unlikely, but that's the reason, in my opinion, why things are missed. We're asking social workers to be physicians, to be psychologists, to be educators, and based on their education, they're going to miss things because they simply it's not because they're not seeking the information. They aren't expert in gathering the information as others might be, and what I believe is the most promising approach is really looking at who can help in that initial involvement with the family. Does it need to be structured as it is now with just the child protection worker and the child protection agency having responsibility pretty narrowly for determining did abuse or neglect occur and are services needed? Or are there people who know the family who actually could be part of a process that might not be as as confrontational and might be more informative and helpful to the family? So I think that's a lot of the reasons why things are missed.
All right. I appreciate that information. You said something there that kind of made me think of something else. I just wonder if, we have a number of people that likely aren't making visits to the physician. They likely don't have insurance. Maybe the children are covered, but the adults, because of poverty issues, likely don't have insurance, likely aren't making trips to the doctor, and maybe because they aren't as adults, maybe then the children aren't also, getting appointments too, because it's just not something they're used to doing. And then to your point, the physicians are mandated reporters. So maybe, there's a gap there just because that's another set of eyes that isn't seeing a particular family. So I appreciate that information. Thank you for being here.
If I could just add one other piece to that I could have mentioned. When I was in Los Angeles, one of the things that we did was for children under age 1, so newborns, we sent out a public health nurse along with the social worker, and essentially saying that 2 people needed to see this situation. You're going to miss things if only one person goes out and is trying to assess a family with an infant. And the family reacts very differently to a public health nurse than to a child protection worker. And it can be better for the family as well as better for the system. So I think there are ways of approaching this that are worth consideration.
Did you have a follow-up, or Senator Holscher?
No, I'm good. Thank you so much.
Okay. Yeah, and thank you for that additional comment. That kind of, I was going to follow this up with a kind of an anecdotal question of several years ago. I got a phone call that a physician's office, and it was the physician's office that called me, that they had reported a child that that they diagnosed as abused, and a social worker was sent to the home and observed in the home, and made the decision that there was no abuse, that there was no concern. And so the doctor's office called me because I don't know, they knew my name from somewhere. And, I guess from your comments earlier, my question would be, how could that be handled differently? Because obviously there was a professional that had a relationship with them that said there was, and a one-time visit to the house would not have recognized that. Adding the nurse, I think, would be a benefit in that particular situation.
There are also states that are looking at changing the responsibility for the mandated reporter to also bring their expertise in helping the family. So that there are situations where a mandated reporter has to report, even though he or she feels that they could offer interventions that might be helpful for the family. And have typically been unable to do that because they're told we need to investigate. If that physician were able to offer some help to the family that may not be typical through a physician, but recognizing that this is a family who otherwise might end up in child protection, there may be some ways of moving that, and some states are taking a look at that right now.
I've got another question that I'm not seeing which graph it was on, but we had a peak in 2020 of, I believe, children coming into care.
It's I think the third one, and we didn't.
I mean, I've heard a lot of statements made that COVID caused a lot higher rate of children entering care. Do you have any comments on that?
Sorry, that there's concern about a higher rate.
Yeah, I thought I saw it really, really spiked up here it is. Ratio of entries compared to exits. Do these have a number? It's right before reasons for system failure slide.
Yep, I have.
Oh. You found that would, so do you see the spike there in 2020?
Yep.
Could that be reason that's part of the COVID pandemic?
It's So nationally, the numbers didn't spike. And so it's hard to say what happened here. It just because I think the trend ended up being different than what people had predicted nationally with the pandemic, and there wasn't a spike. And as a matter of fact, the future numbers will probably show some decline there. So it is hard to say.
Okay.
I,
Well, and the secretary can probably address that when later in her presentation too. But do we have other questions? Or Senator Fauskido?
Thank you, Madam Chair. Concanon. Can you hear me? Is my mic working? Um, Madam Chair, whoever invited Dr. Sanders, my hat goes off to you. This is wonderful, Dr. Sanders. It puts everybody in the room on the same page. This is a catalyst. I've served on the committee for years, and it sounds like what you've presented. We now have the same goal, those three questions that you asked. And my question to you, in your expert opinion, um, when we talk about the public and the public's perception that DCF or the legislature that we aren't doing enough for families, with understanding the code and HIPAA and etc. What do you think that we can do to build that relationship, bridge that gap of what information can the public know so that they understand something is going on? So can you speak to that? And then finally, Madam Chair, Dr. Sanders, how did the name Casey derive? Thank you.
so the first question is certainly a challenge. And I have some thoughts, but I don't say them with any illusion that it's easy to do because it's clearly the I'll give an example, personal example. When I went to Los Angeles, and it's a big system as you would imagine. Literally the first day that I was a director there and went into a meeting, there was a reporter from the local news, and he talked about how feared the agency was and how he could easily get people to come and protest in my office, and that we were more feared than the police in Los Angeles. And I'm not sure that that's not true most places. That the ability to come in without clear reason for a lot of people and to be able to take children is just it's such a powerful tool of government that I think because it happens as routinely as it does, we may lose sight of it. But to communities, it's it is the overwhelming vision that they have of what the Child Protection Agency is. And I know that Kansas is by contracting out many of the services does to some degree get kind of closer to the community. But I think that it's important to think about some of the questions that I raised here, because do you want an agency that is seen as being fearful, is seen as being an enforcement agency, or do you want one that's being seen as helpful? And I think that can be determined by legislation. You could decide, for example, that the information is going to be more proactively available to the public, and so that people are able to act on information. That would build more trust into the system. I think the that the role of the agencies that you have contracted could be expanded to include the notion of their responsibility in building community. In most states, and I can't speak for Kansas because I didn't look closely, but in most states, you can predict the communities that children are coming from. So you can put resources in those communities to say, we're going to approach this work differently. And I think, for example, Community Pathways does that. So I think it's possible to do, but it's a commitment, that a long-term, strong commitment that people have to make to say, we're really going to see this as an agency that's a benefit to the public versus one that's feared by the public. Oh, so Jim Casey, the UPS founder, founded Casey Family Programs. Actually, the first foundation that he created was Annie E. Casey, which is in Baltimore. That was founded in 1948. And then he created Casey Family Programs. And I say Jim Casey, he was the founder, but actually his sister, Marguerite, funded a lot of the work. And the Casey Family Programs was created with a narrower mission and more of a focus on foster care. But that's where the name came from Casey.
Representative Humphreys.
Thank you, Madam Chair. Thank you for being here. You have struck a nerve with me. And you're saying things that are true solutions, and I so appreciate that. So the first thing that you said unequivocally is 2 years in temporary care is it. No child should be longer than 2 years in temporary care. And amen. I don't know what else to say. We've got to do something about that. Then a couple of questions. The ratio of entries to exits, it has, that's the question that the chairwoman was asking about, I mean, the slide. And it is up to age 22. So that is kiddos that age out of the system. So I don't know if we're able to get some data on what happens, excluding the kids that age out, but the ones that are actually in care and don't receive or do receive permanency while they're in foster care or while they're living with foster family. I would love that data. And then another question, and then the next slide, which reasons for system failure, the poor public perception. And you listed a lot of things, and I would submit, I'm adding to that. Part of the public perception is that foster families burn out and they're not taken care of and they're not supported. And so they don't repeat. So we have these foster families that are experienced and know what they're doing, but they just do it once because they have such a bad experience with either caseworker turnover or they have fostered a child for 2 or 3 years and then are not considered in the adoption process. And we don't take attachment into consideration. And I think the public understands that. And there's some great organizations, and I'm assuming one of them is yours, that kind of comes around foster families to support them. Would that be something that you've seen as far as other perception of the agencies?
So yes, is the short answer. I would probably add a couple of things. I think that, and I don't know here in Kansas, the organizations I was responsible for, as well as most that I've seen as in this position, the people who are responsible for foster care are social workers who decided that that was their career choice in the in the agency, and so they have moved to that position. And so foster care recruitment, foster care licensing is generally done by people within the agency and who've been promoted or moved over there. The given the seriousness of it, one should at least wonder, should it be people who are professional at marketing and who understand relationships better than, as it relates to being a consumer, better than a child protection worker would? A child protection worker has not had to deal with that same situation. Not at all criticizing the workers, because they do just incredible work.
Mm-hmm.
But should they be the ones doing recruitment and licensing of foster parents? We've seen some models where they have brought in people who are expert at marketing. They have a completely different approach to reaching out to families, and they don't let families just drift away. And so, and those are things that they know because of what they do, and it is what they do. And I think that, so I think the answer to your question is yes. I think there are ways of dealing with it, but probably not the way things are structured now that in most agencies. And I'm not sure what happens here, but perhaps, perhaps it is happening here. But most places in the country, you're a social worker, you are assigned to foster care, and you end up treating the families in the foster families in many ways as you are treating the families who have been your clients in child protection. not necessarily thinking of them in a different role.
That is fascinating. Thank you so much. And Madam Chair, if I may just, thank you so much. The lack of definition of success you mentioned, and I'll be honest, I'm tired of hearing in all of these committees how great everything's going. That's what we hear. And when we ask hard questions, we get an answer that says, we'll get back to you on that. And I think what you've shown and is that an honest discussion, we want to help. We're not here to play gotcha with our agencies or with the contractors. We want to help. And so I think honesty and accountability that you've mentioned really has brought something to light that is very important, that we're in this together. And so I appreciate that. And you mentioned reporting. Do you think that, really good reports about these numbers would be helpful in that regard? Or what would you suggest in how we are like partners? We're not trying to criticize, we're trying to help, but I feel like we don't get honest answers.
I've certainly found that having agreed upon measures and reporting on those regularly creates a sense of working together. That it's that if the goal is improvement and not finger pointing, if the goal is improvement, there are many ways to make the kind of improvements that I think I've heard that you're looking for here. But it does have to be based on an agreed upon assessment of what's needed to actually improve the system and how are we going to measure that.
Mm-hmm. And then just my last thing, did I understand you to say that, maybe somehow we should focus on younger kids that have the greatest risk of harm? And what does that look like? Are other states doing that? Like how could we focus on the ones who have the greatest risk of harm? And then that's all, Madam Chair. But I would love to hear your thoughts on how to do that. Thank you.
So, and I again, as I mentioned earlier, I have thoughts, but it really is based on very limited information, and I turn it over to all of you to decide which of those thoughts might be relevant, if any. But I think that, as an example, for this is one of the things that I promoted strongly on the commission. That and this is controversial because we don't want child protection unnecessarily into families' lives. If they brought something helpful to the family, though, it may be a different equation. That if that perception can be changed so that this is a helping agency, could be different. So one of the things that we ended up recommending as a commission was that infants, any child birth to 5, and let me put a little context to it. I talked about the screen out rate and the percentage that aren't necessarily seen. That any child who's reported who's under age 0, who's one or younger, should be seen by 2 people, and every child should be seen. Not necessarily by the Child Protection Agency, but if somebody calls in about an infant, should probably at least see the infant and make sure that they're okay. I wouldn't say that for a 16-year-old. But I would say if there's a call about an infant, given the likelihood that they are quite vulnerable, regardless of the issues with the parents, it could very well be these are the best parents in the world. But the infant may need some supports, and the agency should at least see them. That was one of the things that would be a way of distinguishing by age and recognizing the higher risks that infants have.
That's helpful. Thank you so much for coming to Kansas. We appreciate it.
Okay, I'm going to call on you just a sec, but Susan or Representative Humphreys, thank you for those questions. Those were very thoughtful and things that I had on my mind, and so I appreciate you asking. Senator Faustico.
Thank you, Madam Chair. Dr. Sanders, so can you give an example of, like, a lot of times constituents call me and then I make a call to DCF, and then I'm told, well, you got to get a waiver so I can talk to you about it. And then all that time is lost in between there. And I hear all these different stories. And it's just, so the communication there. Can you speak to that? Thank you, Madam Chair.
Yeah. So one of the things that I've seen that has worked well is that, and I know that you are considering the child advocate position, is for the agency to also have a similar structure of taking concerns in from the public, so that calls aren't necessarily coming just to the legislature, but coming into the agency. And if they come from both places, having an ability to share information then, so that it's not just the legislature who's hearing things, but the agency, and really having an ability to share that information, because the most families that call just want to get the issue resolved and they want to talk to somebody, and they will keep calling until somebody finally talks to them. And so I think that's one of the things we've seen that I've seen that has worked. I think that I think that and I again don't want to make it overly complicated, but that privatized agencies that are in communities also have, I think, in some ways, an enhanced opportunity to connect better to communities, so that that people feel that information is going to be dealt with through the agency. They are part of the community in a different way than the government agency is. And I think you have a structure in place that might allow for greater requests, that they have something in place so that they can take calls and they can handle situations that don't need to come to you.
Representative McDonald, I'll say just before you ask, we're getting to the 10:30 time. Are we still okay? Can you stay for a few more minutes? Okay.
As long as I don't get a ticket going to the airport.
Well, we heard you are a fast driver. So, Representative McDonald.
Dr. Sanders, one thing you said that stuck out to me a lot is about 80% of kids put in placement are there because of neglect. And you said something about poverty versus neglect and how sometimes it's hard to distinguish. Can you talk a little bit more about that? Like, do we need to look at our social worker training to try to help with that? Or what can we do with that poverty versus neglect piece? Thank you.
And I can only, I've been incredibly fortunate to be able to. I was not a child protection worker, but to go out with workers when they're doing an assessment. And I had, I don't know, 5-6 years of training as a psychologist. You go into a home, you have 5 kids in there, everybody's running around, you're trying to gather information from a family that doesn't want to give you information, and you have to make a decision on the spot. And that's the challenge, is that if you could step back and assess things, you might be able to make a better assessment. But they're making decisions in such real time, and there's so much confusing information coming forward, that if somebody says that my refrigerator's empty because I don't have any money, is that true? Is it not true? Or is the refrigerator empty because they've spent it all on drugs? Or is it empty because they have a mental health issue and they think that there's negative things in their family that they want to make sure the family members are punished for? I mean, it could be any of those reasons, but a worker is not going to be able to distinguish that in an hour visit where they're trying to decide, do I take these children or not? And I know that in some situations in Kansas, that it's also law enforcement making the decision, probably even more challenging for them because they have other things that they're trying to deal with. Does that get at what you're asking?
It does. I was hoping you had a magic wand to answer for me though, and how to address it, or how to at least be really thoughtful about being proactive in that regard.
I do think that and people talk about the cost. I would probably argue about that, but I think that if that it is enhanced when you have 2 people there. That when you have 2 people actually investigating versus 1, you can compare notes. There's a lot of information that a second person will catch that one simply will not catch.
Thank you.
Representative Ousley.
Thank you, Madam Chair. And thank you, Dr. Sanders and Carol and Simone, for your interest and input into the Kansas child welfare system. Joining us here today, I think the committee's got a strong interest in the definition for neglect. Are there any national conversations? When you mentioned abuse and neglect, you said almost unanimously states go by the federal code for abuse. Is there any discussion on the federal level for an updated neglect definition?
So the short answer is yes. That certainly it is a topic of conversation that is both. I know people in the executive and legislative branch at the federal level are having conversations. But the federal definition, I think, most people would say is pretty solid because it addresses the imminency of harm to the child. It addresses the seriousness that this expansion of states is in part a question of to what extent should states be allowed to make their own definition of neglect. And I don't think that I've not heard conversation necessarily to kind of limit that. And so it's not as much a federal that the federal definition necessarily needs to be changed. That if states were using the federal definition, the front end numbers would probably look different. And we've seen some states that have made changes, and the entries into care has been impacted almost immediately.
Thank you for that. And if I may, Madam Chair, to Representative McDonald's and your comment on the two-person visit, for our youngest, is there a measurement on that? If I'm listening correctly, and always correct me if I'm not. That people would argue over the cost. Is there measurements in other states where that type of system is used and there is a cost benefit analysis?
We are not, and this also came out of the commission. We were not aware at the time of any state that was doing that. People have tried it as experiments, but not done it statewide yet. And so that's and in part because of I think the earlier question of things being missed. That happens so consistently across the country. We just haven't seen a way, aside from really changing the interaction between the family and the worker to get improvement there. That the training has certainly been enhanced in different places, but I think every place would say they experience these real what appear to be egregious decisions on the part of workers. Again, I don't know that they are. I think that we're asking workers to do nearly impossible things, but they end up with situations that seems that people would say it was so clear that they should have intervened. And so we thought strongly that the teaming that we did see in other fields, certainly law enforcement does it, and to some extent healthcare does it. So that's what we actually pulled it from, not from child protection agencies.
And I appreciate that. And we have two pilots on the airplane and two conductors on the train. One other thing, you mentioned multiple permanent homes. You said if this permanency placement doesn't work out, we should get other ones. And I think that's relatively new. If that's been mentioned in committees before, it's not something I've picked up on. But is there a measurement for that? Is maybe unique to Kansas or maybe nationally, because it seems like if you're looking at your graphs, you've got permanency or you've got foster care. I don't know. Maybe that's something the secretary could comment on more when she's up in front of us, and maybe it's something that I just haven't heard worded that way. But again, I'll thank you for your time and your input here. Much appreciated.
And if I said multiple permanencies, I misspoke. I mean, there should be one hopefully successful permanent decision that's made, and but distinguishing that from remaining in foster care, which puts situations as temporary. Almost everything is temporary for the child then.
Thank you. And I may have more discussions on that and look at the notes more. I might have misinterpreted. Thank you, Madam Chair.
Maybe do we have any further questions? I'm going to do something really unusual because this is such a special treat to have you here, but we have a lot of professionals here in the room, and I just wanted to, if we could maybe take a couple of questions from the guests that are here. If anybody has a burning question, just stand up. Oh, we'll come back to committee. Senator Gossage.
I would like to echo, thank you so much. Thank you, Madam Chair, for bringing this conferee. Really appreciate that. I too was struck by the 2 years of Noble Goal. I know I was then reading some of the other reports that are going to be coming before us a little later. It's noted that we have fewer foster parents than we did last year. And so what are other states doing to try to reach this 2-year goal that we all want to see? But if you have fewer parents who are willing to adopt, that can make it more difficult. And also the final termination of rights from parents seems to be a difficulty as well.
So I'll just mention a couple of things. In terms of the fewer foster parents, a number of organizations are reporting that. That's not inconsistent. I think for some of the reasons raised earlier, that's what foster parents across the country are saying, is that they just aren't getting the support that they need. I didn't mention the increase in placement with kin, and Kansas is one of the leaders in the country at that in terms of the placement. It is that I believe that's actually probably the strongest potential solution to the challenges of foster of having too few foster parents. But I'm not. I believe we have too many children who are in care for too long and haven't achieved permanency versus we have too few foster parents. I think that the foster parents can that there are that if they believed that they would play the role that they were asked to play and they would be treated respectively, I don't think we would have a shortage of foster parents. I think that they end up keeping children for much longer than had been anticipated, running into some of the situations that have been described. And most of us would not stay doing that work if we didn't feel appreciated. And I think that happens a lot of places in the country. And I think that that's driving much of it. But I think kinship care. The other part of that is is thinking of the supports for foster parents and kin, and what kind of models that need to be in place. But I think that the major issue for me is how do you get kids into permanent settings, and it may be with those foster parents, but really needing to make decisions much more quickly. And one way that that happens, because the court has oversight through all of this, is more frequent court hearings that are designed to move things along much more quickly. If you have a court hearing every 6 months, in 2 years you'll have 4 court hearings. That's not going to be enough to make a good decision about whether the child should stay with their family forever or not and where they should go. And so I think that how the decisions are made and the speed with which decisions are made is critical, and states have addressed that in some cases.
Thank you, Madam Chair. I'll have more follow-up questions with the department. Thank you.
All right, one last chance, everybody. Oh, Sister Therese. Could you come to the mic because the people online can't hear you? Thanks.
I appreciated your comments on the kinship care. Can you speak a little bit more about the resources that should go with a child placed in kinship care?
Great question.
Also, one of my favorite topics, although not everybody agrees with me, so we'll see. The foster care is an entitlement for the child. So the child brings resources with them wherever they go. Doesn't matter who the caregiver is. If the caregiver is a kin caregiver, they should receive exactly what the child needs as determined by 4E. It is the who that is doesn't matter. It is what the child needs. Looks like you might have agreed with them. I like it.
Okay, I think that was, did I see a hand? Okay, so Representative Humphreys.
I just wanted to go back really quick to that protecting the 0 to 5-year-old. Is there any sort of nexus with that with, our growing homeless and tent communities and, how do we protect those 0 to 5-year-olds when we know more and more of them are now homeless or living in tent communities or what? I mean, do you have any surmises about that?
Well, so I actually will. That's what I have a personal experience with because when I was in Los Angeles, I mean, there's Skid Row, and you have at that time there were children on Skid Row. If it has got to be the most dangerous environment in the country, and so, but the child protection statute in California prohibited child protection from being involved if the issue were homelessness. And so the agency could not get involved if the issue were housing. And so what we worked on was actually a team that included um, a number of other people, but that really focused on children on Skid Row, and were able to offer necessary supports because the families were prioritized and so forth. That number of children went down dramatically. I think it has to be something that's approached as a team. I think that the resources are not going to be with the Child Protection Agency. I at the time thought it was maybe too much for Child Protection to take on, but in hindsight, it made sense because you had mental health, you had housing, you had substance abuse, all working with the family to say, this is just too dangerous a place for your child.
So those were nonprofits that got involved since the agency couldn't, or
So the agency was part of the team, but did not open a child protection case. So was able to offer expertise to the team, but did not. It was not a child protection matter.
thank you. Thank you, Madam Chair.
Okay, I know we're going to have to let you go. Do you have any final comments you'd like to make before you leave us?
I just think that what I said in the very beginning, this is it's the most important function that we have as government, and I really appreciate all of you taking this on because if you've ever been to a court hearing with an adoption or been at the front end with a child being removed from their family, the potential for very inhumane things to happen to people who are truly innocent is huge, and I think that your attention to it really does make a difference. Thank you.
Oh, thank you. This means so much to us, and we really appreciate you being here. And safe travels back. Are you going home?
I am.
He's flying back to Seattle. So I failed to introduce Simone and Carol earlier today. I think most of you on the committee have had an opportunity to meet them this week, but would you two stand up? This Simone Weil and Carol Self. And Representative Owsley and I had an opportunity to work with them in December when we attended what was it called? A summit in DC on child welfare. So thank you for being here, and thanks for spending some extra time this week with committee members. I think I'll follow up here while we're transitioning. And I thought of a comment I'd like to make. I've thought about in the past trying to put together some sort of field trip for this committee as a learning experience. But I think from his comments, I think that I would just recommend to each of you to contact one of the contractors and see if there's a way that you could go on a home visit. And definitely, I encourage you to visit one of the court sessions because both of those, I've never been on a home visit, but I know I've attended court and they're very powerful experiences. Those are things that we probably could not, well, I know the home visit we could not do as a group. So I would encourage you as individually to have one of those experiences. Okay. Another thing I've neglected to announce this morning is that you have at your place um, two notes from the revisor statutes. One is a review of all of the bills that have anything to do with child welfare that are still active in our legislative process this session. I don't think it's in your packet. I think it should be on top with where your agenda was. Okay, I might have stole yours.
Okay.
I'll make sure you get one. And then the other is a brief that Representative Howerton had requested on the rights of biological parents in the sync code. And did you author this, Jesse? Jesse, anxious to read it, look at it. So it's a thorough response to that. And then as you are all this evening reading through your sync code book, all of that can be found there too. Most of it. Yes. Oh, it's behind the folder. We'll make sure you get those. Who does not have one? And okay. Are you missing both? Okay. And all of you have one? Okay. And for the senators listening online, I have a sync code book for each of you, and we'll make sure that you have these handouts as well. I think you probably can access them online. All of these can be accessed online through the S Drive. Okay. Okay, we are going to hear from individuals that are here today that wish to speak from the public. I have Ashley Kriego, and there's a note that she is ill today and that Sherry will read her testimony. Is Sherry here or on WebEx? Okay.
Ashley, what Ashley wrote.
Tell us your name again.
I'm Alma Ann Jones. I come from Wichita, Kansas.
Okay.
Good morning, everyone. Thank you again for. Sorry, Siri, didn't interrupt. Good morning, everyone. Thank you again for giving me an opportunity to speak on my brother's behalf, as well as the children that I serve in my community. I previously mentioned that the first time I spoke here, my testimony was left out of the YouTube video and answered a few follow-up questions regarding the situation with St. Francis's treatment of my brother, which has neither improved nor been resolved. Upon my return back home after the last meeting, I was informed by someone online that during my testimony, my microphone was muted, despite it functioning just fine for the people directly before and after me. And my testimony was again omitted from the video that was uploaded. When I inquired about the reasoning, I was told it was a technical issue. Twice I've poured my heart and soul into speeches that I hoped would embody the essence of my brother and humanize him to those who can do something about it. And twice I've been stifled. I don't mean to come across as angry and bitter, but it does feel intentional. I don't know what points to touch on because I don't know what will be included at this point. The absence that my family feels every day can't be put into words, so I will speak with the silence that I am forced to work with. For the remainder of my time, I would like to take a moment of silence to acknowledge my brother. His name was Andrew Thomas Iverson Jr., but we all called him AJ. He loved animals and helping others and was the most pure soul I've ever known. His favorite band was Green Day, and even though he was 17 and 6 feet tall when he died, He still played swords with sticks in the yard while running around in his boxers, and he asked for a hug before bed every single night. He didn't have the theory of mind to control his impulses as well as you or I. That's why we were begging for help. But he did deserve to be here. He should still be here. Thank you, Ashley. And before the moment of silence, I want to interject here that I've been working with the family since AJ's death. And what the doctor had said about having a nurse with them. AJ, when the social worker showed up, and Sherry begged him to take AJ to be watched that night because she knew he was on drugs. I believe if a nurse had been there, he would have been taken to a facility. He would have been watched that night, and he would have woken up the next morning. So I think that's really something important you should look at.
Okay, we will honor your request for a moment of silence. Okay, thank you, everyone. Next up, we have Sherry Lasher. Is Sherry here? Okay. Welcome to the committee. I didn't mention this earlier, but I don't have a timer running on you, but I'd like for you to keep your comments to 3 to 4 minutes, please.
And thank you for hearing me. I've never really thanked the chairperson. It's not out of rudeness. I did not know. And so I thank you for your time. Ashley spent all night last night making these packets. I don't know how to hand them out or when's an appropriate time to hand them out.
Are you referring to Ashley Kriego?
Right.
Okay. I'm sorry, I didn't realize that they were connected. Oh, I didn't recognize you.
Yeah.
Okay, sorry about that.
So anyway, I thank everyone. And I'm sorry to keep coming back, but he was my child. I'm gonna go back to November. We had a roundtable meeting. Olitha was there. A couple other people were there. But it was supposed to, my understanding was to resolve these issues. And what actually occurred was a farce, in my opinion. It was a bunch of circle talk. And I'll just read from in early November, there was a meeting set up with people relevant to our experience with my son's death. During this meeting, after Senator Olitha spoke of my son's funeral and why that wasn't covered, Matt inserted himself and said that he called Yoder Embalming to pay the balance and discovered that there was no longer a balance. Just hearing the words Yoder Embalming stung. The first thing that hit, though, was that I needed to contact them and find out who paid that $200 bill so that I could thank them. I called them immediately and spoke with Haley. She said that she could research it for me and get back with me, but also that she can't recollect anyone inquiring about AJ's bill. The following Wednesday, 5 days later, Haley called and said, "You were right, there's a $200 balance left on the account." I asked her to print it off and told her I'd come by to get it. I went directly there to pick up the receipt. Here's the thing. Why? Why did he say that? That he could have went the rest of his entire life and not put us through that again. There was zero reason for Matt to insert himself. There was even less of a reason for him to lie about it. I asked her how she could be so sure that no one's inquired about AJ. She explained that the account was so old that his records had already been moved to their storage building. To anyone that cares, when you hear the words Yoder Embalming, nothing good comes to mind, especially in reference to your child. As gracious as this facility was to us as a family, We all knew what it represented. This facility was the last place that I saw my child in his natural form. It was in that room that I had to hold people up when I felt like I was going to collapse. It was that room where I watched my grown kids and their families, AJ's siblings, falling absolutely apart, and as their mother, not being able to fix it for them or help anyone. It's where I hugged my son for the last time, feeling the plastic under his hoodie. The stillness of him was absolutely contrary to his nature. These are the doors and a few more that Matt opened in my head by inserting himself with a blatant lie. I'm wondering why. Why is it necessary to re traumatize and taunt us for no reason? It's been this way since the beginning. And we've given you guys examples on top of examples. So every time we come up here, I'm not reading from this now, it's told to us and we're asked, we can't bring him back, so what do you want? We can't bring him back. So what, you know, and you're right. But for all the trauma and the harassment and the taunting, sitting out in front of our house, coming in 7 years of therapy now, 3 of my kids have been admitted to a psych ward since this has happened. 3 grown kids. My daughter, she's 18 now. She works on the level of probably a 13-year-old. This shunted her so bad. And it was for nothing, for naught. It was, they did, if they would have just done something, anything, there's a huge chance we would not be here right now. AJ deserved that. So my asks this time, since everybody wants to get to it, my asks this time, there is still no facility for these kids in Wichita. They're either in a psych ward, they're put away. There needs to be some kind of respite care. I want an AJ house down there for parents, for overwhelmed parents, for overloaded kids. And I don't think that's a huge ask for Wichita. I know Kansas is sitting on some money. And as far as all that other stuff, at this point, I've talked to my entire family about it. And I don't know the amount, but yes, I think that there should be some kind of settlement at this point. This did not have to happen. And the fact that it's continued to happen now for almost 7 years, this could have been resolved in year 1. They could have come forward and said, man, we messed up. That's what I was teaching him. Accountability. And that's what everybody's having issues with now with these agencies. Transparency, accountability, and there's still none. 7 years later, I'm still fighting for justice for AJ. He shouldn't be where he's at. If you guys would have seen him, he was a precious, precious little sweet, innocent soul. He stood this tall, but he was great. He was absolute. I can't even tell you guys. And I'm giving it all to you now. And I think that, like I said, 7 years of therapy, 3 inpatients, just everybody has, we didn't have to go through all this. I would love to get to a point where I could think something about my son without having this agency attached to his name. I think that's fair.
Okay, thank you for sharing with us today, Sherry. Let's see, I have Nick Reinecker listed, but he is not in the room and apparently not on WebEx. We also have Sean Wilson, who that will be written only. He's ill today too. Was there anyone else who attended today that wished to speak from the public? Yeah, well, I'm just, yeah, so I'm going to open it up now for any questions or comments for the last 2 speakers.
Thank you, Madam Chair. And I just want to say, Sherry, we hear you. You may recall the last time that we met, and I'm the one that requested that roundtable. However, I was not notified until afterwards, or I would have been there. Thank you for coming with what you consider to be resolution. We have talked about that. And I just want to say that we appreciate that. Thank you very much. Thank you, Madam Chair.
Okay, anything further? Senator Fasquedo.
Thank you, Madam Chair. Sherry, Alma, Ann, on behalf of AJ, I do appreciate, you made me feel really sad, but that you went ahead and presented your ask. So thank you. Thank you.
Okay, committee, anybody else? Okay, thank you. We will move on to, we're a little ahead of schedule. We have the Kansas Division of the Child Advocate update. And welcome to the podium, our advocate, Carrie Launard.
Good morning. Good morning, Chairperson Concannon and Vice Chair Gossage and Ranking Minority Leader.
We will move on to, we're a little ahead of schedule. We have the Kansas Division of the Child Advocate update. And welcome.
Good morning, members of the committee. I was going to say I will try to move through this for Representative Johnson, but I think we're ahead of schedule. So thank you for having me here this morning. For many of you in the House, some of this will sound repetitive as I did present to one of the committees just an update regarding our 2023 annual report. So as I walk through, hopefully if I won't miss anything that we discussed and shared at that point, but look forward to other questions and good discussion. I think that the doctor this morning laid some really critical groundwork for us as we look at some of the numbers and the concerns that the Division of the Child Advocate is hearing and seeing, and some of the recommendations that have come out of those concerns. So just for a couple of you who may be new to the Joint Committee, the Child Advocate Office was initiated by executive order in October of 21, and I was appointed in December of 21. So we've just completed approximately 2 years in really building the division, taking feedback and hoping to continue the work and having an impact here in Kansas. So the primary goal and mission of the division is to receive and hear concerns of our community members, of our families, and look at those concerns, complete an impartial and independent investigation into those issues that are voiced, and then work towards resolving those concerns, looking at policies and practices, looking at our statutes, looking at the impact that it is having. And as we heard this morning, thinking about what is it that our goal is for our state and what do we hope then to move forward in achieving for our children and families. So as our division has developed, we have looked at it very broadly under our executive order as far as who can bring a concern to us. So as I've shared, I think historically, there are some states who have limited who can bring concerns to their child advocate office. Right now, we hear really from any community member. And so as you look at who may contact our office, this is fairly consistent with what we heard from 2022 as well. But the primary people that are bringing concerns to our division are the parent, the natural caregiver of the child. And then we're hearing from foster parents and relative kin caregivers. We also hear from guardian ad litems, parents' attorneys, mental health providers, CASAs, and other community service providers. In 2023, I provided a chart that just really that breaks it down by month of the numbers of complaints that were brought to our office first in 2022 and then over this next year in 2023. And you'll see that for the most part, those concerns are continuing to increase over time. So in 2023, we received 214 formal complaints involving 335 children. The concerns that are voiced to the division really primarily focus on concerns with services that are being provided either through the Department of Children and Families or our foster care providers. So Cornerstones of Care, St. Francis Ministries, KVC, and TFI. But we also hear concerns about other agencies and providers. So we hear a lot of concerns around our judicial practices, whether that's our decisions that are being made or practices by our judges, concerns with attorneys, the clerk's practices, and just the overall systemic interaction between our courts and our providers. We also hear concerns regarding law enforcement involvement in cases, KDHE, KDADs, and oftentimes the interplay and decisions that are made by our Kin Care and MCOs. So a breakdown in Kansas, just to give you a visual as far as where those concerns are coming to in 2023. A map shows that the majority of concerns are coming, as I always note, in primarily our more highly populated areas, but we also hear concerns essentially across the state. You will note that there's an asterisk that does show that there were 24 complaints that as they were coming in, we were unable to really narrow down a particular area or region because of the nature of that complaint. So the next slide shows you the breakdown of concerns that are brought to our division. So as concerns are voiced, we try to categorize them within 5 main categories. And then within each of those categories, we have subcategories. So you'll see that in 2023, the 2 main areas of concern that were voiced included agency conduct. And then the second one was family separation and reunification. And what I will say is that was consistent with 2022 as well. It was just reversed as far as the numbers. So when you look at agency conduct, concerns that were voiced around poor case management, turnover, and poor service and communication. Very difficult to separate those as they're all interrelated and impact each other. The around family separation, we oftentimes hear unnecessary removal. So as we were listening to the doctor this morning and thinking about what those investigations are, how those are screened in or screened out, and how decisions are made whether we're removing a child, that's a concern that we often hear. We often also hear regarding efforts towards reunification. And I'll speak a little bit later, I think, around some of the discussion around that 2-year mark and what were some of the things that are impacting our children that are continuing to languish in care.
Carrie, can I interrupt you just for a second?
Absolutely.
On agency conduct, is that DCF and the contractors?
Yes, it is.
Okay.
That includes both.
Okay, thank you.
So the next slide shows you a breakdown of 2023. So as when we open a formal investigation, we do make findings in regards to the specific concerns that are brought to us and whether we find that there's enough information and evidence to either support the concern or we'll find that it's unsupported. And within that, then we will either make recommendations or there may be no recommendations. So you'll see that in 2023 of the concerns, we did support 63 of those cases that were closed during 2023. But also think about as cases come into us, we're not, some of those cases, take different lengths of time. So of the, 200 and some cases, that's not all of those cases. Some of those cases continue to be ongoing. You'll see that as some concerns are brought to us, some of those may be out of scope. So right now under our executive order, we're able to hear concerns that include a child who is alleged to be a child in need of care or adjudicated a child in need of care. So sometimes we do often receive concerns that may be outside of that scope. And so, we still work very hard to try to provide information and resources and information and connect folks to other agencies, other divisions, community resources that still may be able to assist. One of the other handouts, so you'll have my slides, and then we also provided a hard copy of our annual report. What I wanted to make note of is in our annual report, you'll see within each of those primary categories, we did try to provide an example or two of the cases that we're hearing. Whether just a summary, whether we found it supported or unsupported, and if we made recommendations, whether we received an agency response to those recommendations. So the annual report just gives you a quick snapshot of a couple examples within each category. And then at the end on page 34 is where it starts in the annual report. You'll see a full compilation of the recommendations that we've made under each of those categories throughout 2023. So some of the things that, as we're investigating a case, the sooner folks can reach us when they hit roadblocks, the better. So oftentimes, it may just take connecting folks, bringing people to the same space and room. Communication, as you noted on our concerns, communication is a huge issue. So I can think of a case that we have right now where really everybody was operating in silos. So we had all of the providers doing really great services, but nobody knew what each other was doing and how the decisions and the services were impacting the youth that is involved in this case. So in getting involved and hearing the concerns that were voiced, we now have monthly meetings where everybody's in the same space. We're checking in with who is supposed to be doing what. Has that information been shared? What are the roadblocks that this youth is continuing to face or the service providers are facing in making sure that his needs are met? Oftentimes, unfortunately, concerns get to us where decisions have already been made and there's been a significant time period that has been passed. In those situations, we can't go back and change what has already occurred. But what we can do is try to provide information about how or why those decisions may have occurred, help just educate and help understanding of the systems, and then hopefully provide some direction in moving forward. This committee is well, I think, informed as far as just the projects in 2023 that we have shared with you previously. The first one was the former foster parent survey, which did provide, I think, some really critical feedback from our foster parents in regards to their experiences, the pros and the cons, the positives and the negatives. And I think Representative Humphreys really pointed out some of those things that we're continuing to hear. And so I think we've been informed. We have some good feedback. I think that there have been some important changes by some of our providers in taking that feedback and trying to make some changes, but we have work to do still. Another key, I think, piece of addressing some of those issues was that the legislature passed the foster parent Bill of Rights, which I think is a critical move in ensuring that we're treating our foster parents with respect and that they're considered a professional member of the team. The second report that we had and project that we had in 2023 was the best interest staffing report. And we did share that at the last committee hearing. It's available on our website. There were some recommendations that were made out of that. What I will share is that there were some changes that have been made as of January of 2024 by DCF to agency policy. It's a step in the right direction. So they took some time, evaluated some of the feedback that was provided to us through those best interest staffing conversations across the state. They reviewed their policy and there were some significant changes that were made. My understanding is that is just the beginning and that those conversations are going to continue to be had and work on that practice and looking at really, are we addressing and meeting the needs and identifying the families that achieve permanency for these children. And to get to what I think is maybe the most important part of the conversation today is thinking about what can we do as a state to make some changes. And I appreciate, I think there was a statement earlier about that we're not here to point fingers. We're here to work together to find solutions and make positive changes in our systems. And what I will say about our division is that has really been our kind of critical foundation as we build our role. Is that we want, it's important and we're tasked with holding folks accountable and making changes, but we want to make sure that we're standing with our workers, with our foster families, and more importantly, with our children and our families to make those changes for systems improvement. So some things that we have recommended based on what we were hearing in 2023. So placement stability and mental health. So we know we continue to talk about those issues. We know that those are critical pieces of the settlement. We know that our communities and our children and our youth and our families are continuing to face that as a barrier and a roadblock to really moving forward. So we would just encourage continued work as you hear from providers about their initiatives that are going to address those mental health needs within the communities. That are going to be addressing and providing services around substance use. I will say that as we are looking at cases, and this won't surprise any of you, that substance use is such a key component of so many of the majority of the cases. It's touching our children, it's touching our families, and we need to make sure that we're providing those services for the parents and for our youth. We have a lot of youth that are struggling with substance use within our system, and those resources are very limited. And so looking at how we can expand those resources. Looking at supporting our workforce. So we know that that's a challenge. And when we think about, as we are hearing issues with communication, turnover, all of those things oftentimes are related to our struggle with our workforce, the high turnover. And so some things to think about. I would encourage the committee, as you guys look at different initiatives and legislation, to think about the House Bill 2484, which addresses the social work licensure compact and how that may improve access to services here in Kansas through potentially a compact. I would also encourage, and I think Can Coach is now on the agenda, so I won't speak too much, but I do think that it's an important initiative to consider and think about the impact that it's having. As we're reviewing and hearing cases and we're talking to workers and families, oftentimes supervision is such a key piece. And so if we can build that support for our workforce, that's only going to improve the services that are being provided. So I talked a little bit about some of the concerns that we hear in regards to the courts, and those include, a lot of it includes even the practices of our attorneys. And although we're not reviewing ethical complaints or concerns regarding attorneys, there's another avenue for that. We do hear and consider the impact that it can have on a case. And so I do think that we are at such a critical place here in the state to be talking about how can we look at the impact of high quality representation, both for our parents as well as for our children and our youth. And so I know that Senator Humphrey's committee did have, I think, really great hearing on a bill that's looking at whether we remain with a guardian ad litem model versus a child-directed attorney model. There's a lot of I think things to consider when we're looking at that, but I think it opened, it connected a number of folks together. It opened some conversation that needs to happen about why are we having this conversation in the first place? What are the concerns? How are we ensuring that youth and children's voices are being heard and advocated for in order to hopefully then achieve that permanency more timely? We talked one of the other things that we hear often is the limited access to our appellate courts as far as being able to appeal a decision that has been made by the court after termination of parental rights. So the last appealable order is that termination. So any decisions that are being made, for the most part, by the court after that, it stops there. And that we hear that as a frustration oftentimes from folks. And so I know that there have been some discussions about what that would look like if we were to open that door. And so I say that in that we hear that concern and that frustration. I think that, again, I think that's a critical conversation that we need to be having and looking at with very specific things to keep in mind and at the forefront of those discussions, which is making sure that we have a real clear understanding of what the statute says, the legislative history of why those limitations were placed in the first place and what went into that decision, and then the applicable case law. Second, I do think it's critical that when we're looking at any legislation that we're making sure that we are ensuring that we're looking at all individuals or parties have the same equal access then if we're going to open that door. And I think most importantly is making sure that the child and their voice remains at the center of that discussion, and that we're really thinking about child's time and looking at that. Considering the discussion around more clearly defining neglect. So I don't feel like I need to go into that too much more because I think we had a really great discussion and information shared earlier by the doctor. And I do think I think we're right at a critical point again in looking at how broad our statute is around neglect, and really thinking about what ways can we then address poverty versus neglect. And then what would that look like as we are trying to more narrowly define, but also ensuring that children's needs and families' needs are being met. So we don't want to leave children in a situation where their basic needs are not being met. So what is it that we need to be doing as a community to make sure that we're addressing those housing needs, those early interventions that can provide those 0 to 5 children who may not be in school. So the other piece that we're seeing and hearing is our children that are continuing to languish in care. You guys saw the numbers that we have a really high number of children that once they enter the system, they're staying there for extreme lengths of time. And so as we look at the reasons behind that, I don't think there's a simple answer. So some of the things that I would just share that our office is seeing and hearing, and I think that I would say that we need to bring the courts to this conversation because they are such a key critical decision maker as far and impact on that is the services that are being provided. So as we think about all the things that we've talked about, once children enter care, what kind of services are we being provided to the parents? There are requirements that we have to meet in order to work that reintegration case plan and those reasonable efforts in order to help that family reunify, assuming that that's the initial goal. And I think what we're hearing and seeing oftentimes is that once it gets to the courts, they're saying we have some concerns about whether reasonable efforts were done. And there's a number of reasons for that. Was it lack of services? Was it because of that worker turnover? What is going on? So I think I think hearing from our judges and hearing from our attorneys and our guardian ad litems will be important when we're looking at why is it that our children are continuing to remain in care even after 2 years. The other piece of that is looking at the initiative, like the work that is being done. If reunification is not viable, what efforts are being done earlier rather than later to identify other permanent options for these children? We shouldn't be waiting 3 or 4 years down the road to now think, okay, reunification wasn't successful. Now what's our permanency option for this child? We should be doing that from day one. and continuing those efforts ongoing. And with that, our office, I note that some of the things to be thinking about in meeting the needs of our youth and particularly those older youth that we have such high numbers that are remaining in care is thinking more creatively about what permanency can look like. And so I know all of you are very well versed in the SO family permanency option, and our division is very much in support of that initiative and hearing from our youth. And so I say that because I think that's one of the voices that we don't always stop and listen to. We as adults oftentimes, I think, dominate the conversation, and we forget to listen to our youth who are experiencing care and what they really see and what they need as far as services and needs and permanency. What I will share is Wednesday, I had a wonderful opportunity to attend the Unheard conference that was sponsored here in town by our Boys and Girls Club of Topeka. And it was an amazing conference. There were some just phenomenal youth that were present and sharing their stories, and had some really great ideas actually. That really, I took some notes and made you stop and think about, okay, what is it that they need? With that said, my colleague and I were we were talking through our experience and decompressing a little bit. And we both stopped and said, we missed such a key opportunity that day though, because our youth were there and we were listening to them. But then oftentimes as the adults in the room, we took over the conversation. And we had some very important discussion and some robust, I think, debate. But that took away from some of the youth then being able, I think, to fully share and express some of the things that they're experiencing and the ideas that they have. So I say that because I think that as providers here today, as committee members, we all just need to pause and remember that sometimes our voice, we need to silence it and listen. And I think Soul is one of a great example of where we've done that. So looking at moving forward for 2024. So as a still newer division and agency, we're continuing to look at our processes and areas that we need to grow and improve. We are working on continuing to enhance our case management system. So we have it now, we're utilizing it. Now we're taking some strategic time to say this is how it's working and this is where we need to improve it a little bit better to make sure that we are being as efficient with our internal processes as possible. Second, we are working with the IT department as they work to just modernize our website, and so some website development there, and hopefully that will improve just access and information and education to the public. And then our outreach efforts, we continue to try to identify different groups across our state to make sure that they're aware of our division as a resource, and that we hopefully can be one other tool in their toolbox in advocating for children and families in our system. So looking forward to the April summit. I think that so many things that we've talked about and that our division hears and that you guys are discussing as a committee and that we heard from the doctor this morning, I think that's a perfect opportunity in our local communities to really start using that as a guideline in the summit. I think hopefully will bring some really important discussion and local plans to address the needs of our children and families. The other piece that I think I just want to make note of that I'm looking forward to is the pilot family treatment courts. So we talked about substance use being a big issue for our communities and our families. We also heard the doctor suggest that more frequent hearings can have an impact on permanency. So I think that those pilot models will be very informative for our state to see the impact that can have on achieving permanency more timely. And just want to thank everyone in this room and all of our providers. I think that we're all here because we care about children and families. And so I thank you for your efforts and your focus on making systems improve. Madam Chair, I'd be more than happy to stand for questions.
All right, great. Vice Chair Gossage.
Thank you very much for being here. As I was reading through the report earlier and then the your PowerPoint presentation, just a couple of things. One is when it says who can file a complaint, and it says any concerned citizen, but it's not limited to the list. So it could be a concerned neighbor
Absolutely.
that has observed things. Just wanted to clarify that. And then when I added up the complaints on page 7, it came to 308, but then the following page it says the total complaints were 214. Were some of these complaints in multiple categories, or why do we have a differentiation in number?
Sorry, I'm just to make sure I understand, Vice Chair,
little
are you
graph
speaking
on-
to the PowerPoint chart?
Right.
Yes. So some complaints do have multiple categories that they may express to us.
Okay.
So we may have a complaint that comes in that would include an issue with family separation, unnecessary removal or reunification, but also around agency conduct or child safety. So many of our complaints do include multiple, in fact, more often than not, they have multiple concerns that are being voiced.
Thank you. That makes sense. Also, we are having final action on the Soul bill in our committee next week. So we are looking forward to that. We did hear that bill in committee. I know it passed out of the House. Also, speaking of passing out, last night we didn't pass out. So we didn't. It was 10 o'clock. But when we finished up voting on the tax bill, it had a super majority, and included in that tax bill is a larger tax credit for parents who adopt children. So I thought the committee might be interested in that. And then, if I may, I have a question about the 48.8% of responses cited lack support of exiting foster parents, and just wondered how we're addressing that. And perhaps I could ask the department about that.
They might be better suited to answer that question, I believe.
This is in our passing the wrong. This is her report that she referenced. In your report that you referenced, you also said the KDCA recommends the state review of restrictions that prevent individuals from holding both a license for in-home daycare and foster care. I've had folks come to my office to say that same thing. Also wanted to commend you on page 20 through 26 here of the report, where you say agency conduct, those complaints, and you give us examples of what was told you, and then the department's responses. That is actually very helpful for us, and I wanted to thank you for that. And then you were mentioning frequent moves by children and unscheduled home visits. I get those same kind of complaints. We probably all do. Maybe just Representative Concanon and I happen to serve on those kind of childcare type committees. I know that Senator Faustido gets a lot of those concerns. So again, this is very helpful, and I just wanted to thank you for that. And finally, there was a recommendation about the attorney to serve as guardian ad litem, or that the families have an attorney. Has there been any more discussion about that? I know that Representative Humphreys had brought this up at a last meeting that we had.
So I think there one as far as the guardian ad litem versus a child's attorney role, there was a hearing in the Senate Judiciary Committee. House Committee. I apologize. There was a hearing, and I think we had some really important testimony that was presented in regards to what that would look like for our state, and there are some really necessary implications, particularly when we're looking at the number of attorneys in our state, how that would impact our courts, and could they fulfill that type of mandate, and also. I think we have to look at compensation for our attorneys if we're looking at changing their caseloads and their numbers and things like that. So the important conversation happening. I think there's people that were connected, like I said, during that committee hearing that I think are going to continue that discussion. One of the pieces that I would encourage our state to look at is really looking at the funding and how we're compensating our attorneys to ensure high quality, whether it's our parents' attorneys to ensure that they're receiving high quality, or whether it's our guardian ad litems or our child's attorney. And so some opportunities for that would be pulling down additional federal dollars. And so I do think that our state is in a position to really be critically looking at what that would look like, and can we do that to improve some of those.
Thank you. I also, the last two things, Madam Chair, is I found it quite interesting at the very end where you have Appendix A and recommendations that you can and have made. And that's fascinating. There are so many of them there. And had no idea. But then you also shared with us, I don't do this, and this, which is also because I thought you had that authority and you obviously do not. So thank you for sharing that with us. And thank you, Madam Chair.
Representative Underhill.
Thank you, Madam Chair. Service provider complaints. That's one of the larger pieces on your pie chart. Can you give us an example of what is that about the service provider or from the service provider?
So
And-
the pie chart that you're referencing on just looking at the number of complaints and who those are coming from, those are who are bringing the concerns to us.
So do you have an example of what a service provider complaint might look like? That one kind of threw me for a loop.
Yeah. So we've heard from our case management providers regarding frustrations that they have working within the system, whether it's high caseloads, struggles with supervision, their relationship with the courts, their inability to, or their relationships potentially with other community members or families. So we do hear from our case management providers. We've heard from our child placing agency workers. We've heard from workers with our Department for Children and Families. We also know that as we receive concerns from other folks, those individuals are also sharing our information with families. So as we may have a concern that's been voiced by the foster family, and when we ask, well, how did you hear about our division? Oftentimes it's from their case management provider or their CPA or child placing agency worker.
Thank you. I had another one. On this particular map, is there a correlation? I know the more complaints come from the more populous areas, but do you know the difference between like caseloads for caseworkers in the higher complaint areas versus say the Northeast or Northwest where it's lower?
I don't have hard numbers. I can tell you just anecdotally, oftentimes as we're seeing some of those increased numbers, we are hearing that there's been some pretty significant turnover. And so we're hearing that from numerous families in that particular area. We also know that folks talk and share resources. So sometimes we may receive a concern from a particular area, and when we ask about how you learned about our division, it's because they've shared it with other folks that are experiencing similar issues. So that's probably a question our providers could maybe answer more specifically about what those caseloads look like.
Thank you.
Senator Pascadil.
Thank you, Madam Chair. Ditto to the comments that Senator Beverly Gossage made. Also, Carrie, I appreciate you coming to Wichita and the town hall meetings we've had there. In your presentation, you mentioned the website. If I could make a suggestion, at least for the Wichita area, that a lot of times those individuals that are caring for those children are grandparents who may not have that expertise on the website. And so at our mini city hall, the Atwater Center in Wichita, if it's possible to get some pamphlets that can be left in his foyer there when you walk in, with a 800 number on it, so that that's utilized a little more. That would be appreciative. Again, I was, Madam Chair, Vice Chair, everybody in the room. I was so delighted to hear Dr. Sanders say that the state of Kansas is actually doing well in kinship placement. So kudos to that as well. Thank you, Madam Chair.
We can try and get some brochures to the city.
Representative Humphreys.
Thank you, Madam Chair. Thank you so much for everything. I had a question about your projects, your two main projects for 2023. and the second one was best interest staffing report. And you indicated that there were some changes made in 24. I'm curious if you could just tell us a little bit more about what they were. And is that like internal rules and regulations, or is that just, hey, this would be a good best practice, why don't you do that? Or kind of what that, a little bit more about that. Thank you.
Absolutely, Representative. So if you turn to
Page 43.
actually, I'm going to have you move a little bit further up, which is going to be starting on page 9 of the annual report, which does provide just a brief summary of our best interest staffing report. And out of that, as I noted, that there were some out of our recommendations, there were some changes. So it would be to our Department of Children and Families Policy and Procedure Manual, as it outlines the best interest staffing process. And on page 10 on the left, you'll see where we did note the changes that were made. So where you can find those on the DCF website, where they post the changes that they make in January and in July. So you'll be able to locate that. But some changes included a more clear definition of the word consensus. And so one of the things that we were hearing from folks that were participating across the state is that people were interpreting that definition very differently and applying it very differently. And so some folks felt that it was, we all have to stay in a room until we all reach an agreement before we can leave, and it's a consensus. Other folks were still treating it more as a majority vote process. The other piece that was, I think, more clearly defined out of the concerns that we were hearing was who was able to participate in that final decision making of the consensus. So what we heard oftentimes is that they were perceiving it as room, what we kind of lay termed room stacking. So if you had 3 or 4 DCF folks, and maybe you had a handful of folks that were from our child case management provider, and that each one was voicing their position as to what the permanent option should be. And so other folks that were participating in that decision perceived that as room stacking, that they were kind of bringing in extra people to have a louder voice in there. And so the agency took some time to, I think, just provide better clarity as to who is participating in that final consensus decision making, and that it should be one voice from one agency. So DCF has one voice. So even if you have 3 folks in there, it's one voice. Same with our case management provider. And also the other piece that I think was better clarified out of the recommendations was who is able to receive really some pretty detailed information about our children and their families and the families that are being considered. And so there's some there's quite a bit of detail as far as financial information, mental health, and other health information, history around how families, what their own experiences were. And those are really important pieces when we're looking at families and how it's going to be the best fit for a child or sibling group. But who should have that information? So they better clarified who should receive that information, just to ensure that we're not, I think, providing things that would be otherwise protected under HIPAA and some other pieces.
That's super helpful. Thank you. And just one other question about your expanded appellate rights consideration. So after the parental rights have been terminated, would you say that, you said it's a critical conversation we need to have, and so would you say that all parties, I mean, I know I'm not going to hold you to this, but I'm just curious, like what if you're thinking everyone needs to have the right to appeal, or the party not chosen, I mean, clearly the other party is probably not going to appeal, or just what might that look like? Because we have, of course, House Bill 2299, and I would like to get that right. I'd like to do something about it and get it right. So we can talk privately, but if you want to explain a little bit about that, it could be helpful.
Sure, Representative, and I'd be more than happy to, I think, to have maybe a more detailed discussion
Mhm.
around that. I think one of the concern, for number one, the number of parties after termination are narrowed, right? So we no longer have natural parents involved because rights have either been terminated or relinquished. But we do have, oftentimes, we may have family members who are interested parties or participating, continuing in the child's life, foster parents. We may have other individuals who are, for whatever reason, an interested party in the case. So I think it's critical that when we're looking at appellate court rights, and if we're going to open that door, that we ensure that I think one of the bills, and I don't have it in front of me,
Mhm.
narrowed it just to the term foster parent, which is a term of art. So when we think about families who are, kin placements or NR kin placements or relative caregivers, we just want to make sure that if we're going to open that door, that we're using the right terminology
Mm.
when we're thinking about those parties. So that's one of the pieces that I would encourage as we're looking at opening that door, that we're really making sure that we're using the right terms.
Possibly a time limitation on that.
I think time is a critical piece. So when we're thinking about child's time, and I believe strongly that that's probably what played kind of as the lead piece in narrowing that access in the first place, was looking at achieving permanency timely for children. So if we have children who've been in care for 2+ years already, we make a decision, and now we've opened this door to then go through the appellate courts. Even when it's expedited, we're looking at months and months and months before there's a decision. And then that decision, then are they going to petition the Supreme Court and see if they would be willing to hear the case? So we could be looking at, potentially years of delay then for a child in achieving permanency. So I do think it's important to be thinking about the impact of, if we're going to open that door, and thinking about how can we limit time.
Mhm. Okay, good. Thank you. Thank you, Madam Chair.
I'd like to follow up with that with a couple of comments. Representative Owsley and I were at the summit that we mentioned earlier, and I asked the question. There were 14 states, is that right? 14 states there. I asked if anybody else had an appellate process, and several of them did. I would say we were one of the few maybe that didn't. And we did ask questions about the delays, because as the House members will recall, when we heard this bill, we heard a lot from the judicial system of how this will be so devastating for children and prolonged length of stay. For whatever reason, I don't know what restrictions they put on that, they're not seeing a significant increase in length of stay. And I asked Dr. Sanders that question as well last night, and he said that the same thing, that he's not, the other states that he has experience with seeing that, he does not see a significant increase in length of stay. So I think there is a way to structure it. We just need to look at how. Do we have other questions? I have a question on your slides, back to that. I think it's page 8, but it doesn't have a number on it. It's after page 7. Looks like this.
Is it the one that has the outcomes, supported and unsupported?
Investigation outcomes. Okay.
I'm not sure what happened to the page numbers.
That's okay. I wrote down the word alleged, and I had asked Jesse a while back, so I'm kind of jumping the gun. I'm going to ask you this question before she has an opportunity to get back with me on it. But the definition of alleged, and as I've read through the sync code, I see what I see are a couple of different definitions. So in your, and I don't remember which, I just wrote the word down, so I don't remember in which of these you made the comment of alleged abuse and neglect. But it reminded me that I wanted to ask this question. When you consider alleged, is it when someone has called in and made a report? Or the other way I've seen it is it the time between when a child comes into care until they have an adjudication declaring them a sink case?
Thank you, Representative, for the question. So it's interesting that you asked that because I just had a conversation, I think yesterday, about about that. And when I brought it up, it was around the terms that we're operating under now under the executive order, which looks at our scope, which uses the terms alleged a child in need of care or adjudicated a child in need of care. So if I was wearing my attorney hat and I was working within the system, when I think about an alleged child in need of care, I'm thinking that there's been a formal petition filed with the court saying that they're an alleged child in need of care. What I will say in regards to looking at the scope of our executive order, we as a division have really interpreted that much more broadly into considering those families and children that there have been reports made to the hotline, and because we do hear a lot of concerns about we've had 10 hotlines and only one or two have been assigned for investigation, and we have very serious concerns about safety. And so we are looking at that much more broadly and saying that there is someone in the work community that is very concerned about safety, and they're alleging some concerns. And so we're looking at that. And is our family? So when we think about our systems and our child welfare systems and what our division is tasked with, and making some improvements and system changes, and being one piece of that puzzle, I think we would be remiss to be thinking about it if we just stopped at when a petition is filed, because we know that children and families are touching so many other places along the way before they get to that point. And also when we're thinking about prevention services, are they receiving family first services? Have those been offered, or family preservation services? Or what is it within the community that this family or child could be receiving? And so that's why I referenced that earlier. If that answers your question.
Yeah, it does. I've asked other people, so I just wanted to hear what your how you envisioned it. Senator Gossage.
Thank you, Madam Chair. In the report, it mentioned, and I know that has happened more than once, maybe I need to ask this to the department. I will finish one of these sentences, I promise. So it initially, there were, in trying to find kin, the complaint that was in your report, you may know what I'm speaking of, that they went to the absent father. And it mentions that the absent father had another child with another woman, said, no, I don't want the child, not interested. After what he considered to be lots of pressure, it said, then the child was put into his care, and then the child was brought back into the foster program because the child was abused. So I think we have to be careful that we don't go so far on to try to find kin that a better option for the child, and it was under child safety here in your report. So how many of those situations have you seen, or do you recall?
Thank you, Senator, for the question. So I think as far as the concerns around the safety of kin, I would say we probably don't hear that many specifically about being placed with a kin or family member and our kin that someone would determine is unsafe, and that there was concerns about fully vetting. I think what we hear probably more often than not is that kin and our like non-relative kin are not being either timely notified or considered. With that said, I think you bring up a very critical point, which is we absolutely want to be looking at family as placement. We want to be looking at our non-relative kin as placement options, but we don't want to do so to a point that we're placing children in even another unsafe situation. And so we do hear it, just maybe not to the number of other concerns that we hear. But I think you guys, the committee, I think heard and had some good conversation last fall around what that should look like, and the considerations that should be done, and that we shouldn't have unnecessary restrictions on family, but we also want to make sure that our children are safe if they're being placed with family.
Yeah, and I will say that I have received complaints before where families were told that they were that the child was being moved to a kin placement, that they felt like, I mean, in their perception, it wasn't a safe place to be, but the concern was that we have a lawsuit against us and we've got to get those numbers up. And that's coming from higher up than, I mean, they're just the workers. So I have another question. I want to ask you on the where I asked you before about the agency conduct, if that would included both DCF and the contractors. Is there, could you split those out next time?
We can try. Yes. So, yes, we can work to see if we can better differentiate between DCF and our case management providers and our child placing agencies or other.
I think that's important information for us. Okay, is that all the questions? Okay, thank you. We will, yeah, I know, it always tends to work out. We will break now till 12:30. So is there lunch here? Yeah, okay. So we have lunch available for the committee and staff, and we'll see you back at 12:30.
half hour went really fast. I had thought maybe we would, while we were eating lunch, hear from Ember Hope, and then I forgot to ask everybody to get their lunch and come back in. So we would like to thank Ember Hope for our lunches today and welcome you. And I'm going to let you say a few words and introduce your group.
And I am with Ember Hope. The first thing that I wanted to do is kind of bring to your attention, we've kind of reorganized a little bit around the new case management contract for Sedgwick County in Catchment 7. And so Ember Hope Inc. will remain our corporate parent, and then we will have 4 divisions underneath Ember Hope Inc. The one that you're probably most familiar with today is Youthville, Ember Hope Youthville. And our residential services, our clinical services, and our child placing agency services, so the workers that are licensing foster homes, all of that work will remain intact underneath Ember Hope Youthville. Lori Gonzalez, formerly was our Chief Program Officer. She has been named the President of Ember Hope Youthville. So she has been with Ember Hope a long time. Of course, we've been in Kansas doing child welfare work for 95, heading towards 96 years. So we've served Kansas kids and families for almost 100 years. I will be the president of the new division, Ember Hope Connections, and Ember Hope Connections will be the new case management contract for Sedgwick County. And we are in the process of starting to transition those child services from St. Francis Ministries to Ember Hope Connections. The other 2 divisions of Ember Hope are probably not as obvious, or probably may not be as important to this committee as the other 2. But we do have Ember Hope Foundation, and that's where kind of our development house lives. And then we'll have Ember Hope Enterprise, where we're looking at some new business opportunities and some business development. So just to acclimate you to the new contract, I wanted to make sure that we've got the name and we've got everyone introduced to myself as the president of that new division, Ember Hope Connections. We are very busy. We got notification of award about mid-February. And so we have literally about a 4.5 month transition period or startup period. And so there's a lot of work to be done in this 4.5 month time frame. And, we've been moving forward for about a month now. We have about 3.5 months to go. And one of the most important parts of this transition is going to be human resources. I think that's very obvious. We're, a human services agency. We serve children and families. So we want to make sure that we have, human resources. So I just wanted to provide a little bit of data about how busy that we have been. As of yesterday evening late, we have received 3,974 applications. That's not a totally unduplicated count. Many people have applied for multiple positions, but nonetheless, we have received almost 4,000 applications. We have done 222 interviews to date. So we are taking resources across our organization and asking everyone to step up and step in to be on interview panels so that we can interview more folks sooner, faster. We've offered 75 positions as of last night, and a lot of those positions have been to existing St. Francis staff. And of those offers, 45 had been accepted as of last night. And so just to kind of, put that into perspective, we've got over 300 positions that we're trying to fill between now and July the 1st. So we're going to remain very, very focused on human resources, and that will remain a top priority. The next priority is IT. And we are working with Kansas DCF. We are also working with St. Francis Ministries leadership about how do we get the data? How does the data get exchanged? And St. Francis uses a system called CMS. And we have learned that an API is probably not possible between their system and our system. We use a product called NetSmart MyEvolve. We are 100% electronic and use electronic health record for everything. And so it does not appear at this time data conversion is going to be possible between St. Francis's system and our system, which means that we're going to be picking up a lot of paper files and then figuring out how to get those paper files into our electronic health record. So that's something we're very focused on, as well as Care Match system. And so all the placement data about kids, everything that's entered into Care Match, we're working with the state to see how we can transfer that data into, again, our electronic health record. And so we've got some moving parts there. We're starting to get important documents like the court report, the case plan, various PPS forms that we have to have actually populated in our electronic health record so that we're good to go on July the 1st. We're also focused on record keeping and what we're going to need to do to maintain the integrity of the record. There are some early audits that we'll be facing in July as a result of just normal scheduled audits. So we want to make sure that we're prepared for those. Another big component is meetings and collaborations. And I think we're doing a great job right now partnering with St. Francis's leadership and working together on how do we successfully transition this contract in Sedgwick County. We're also regularly meeting at least weekly now with DCF administration as well as DCF regionally. And we know that that is important to have that public-private partnership and making sure that we have open communication lines and DCF is readily making themselves available to us. Also, we're meeting with other community and partners, and this is just to name a few, or such as DECA. We know that when a family preservation case transfers to out of home, we know that we need to have that partnership and communication in place. We're also meeting with the Sedgwick County Court judges and court service officers and GALs and parent attorneys, making sure that we have the court connection in place prior to July the 1st. We're meeting with Wichita Children's Home, who will be an important partner to us. And we're also actually met with ComCare yesterday with their Children's Services Department. And again, as our CMHC in Sedgwick County, that's going to be important. The next thing that I'd like to just talk about briefly is the use of evidence-based practice models. And we certainly proposed some changes to how we're doing business. And one of those changes is utilizing a tool called Resolutions Together by Safe Generations. And so this is the first opportunity, DCF, for making the assessments on whether children remain in home or whether children are removed. It's part of the Kansas practice model. They're already using the safety and risk tools that come along with Safe Generations. And I know that Family Pres, I believe DECA is looking at this as well. And then we will be utilizing this for the ongoing work, which is important that we can actually use the same safety and risk tool and assessment process cradle to grave for the life of a case. And so we've got some kickoff dates the end of March. We have a lot of people coming to that. We have DCF administration, DCF locally. We've got some court folks, and we have other providers, the other case management providers. I think a lot of people are interested in what we're planning to do there. We've got others, the crossover youth practice model, which is something that we're very hopeful that we can implement successfully in Sedgwick County. And that particular evidence-based practice model was created by Georgetown University. They'll be coming to train our team and our staff. We will have a dedicated crossover team with permanency specialists and with support workers. And the importance is that they learn specialized practice to work with children who are duly adjudicated in the juvenile justice system and the child welfare system. And how do we better serve those children? Those often are the children that are on night to night placement. Those often are the children that may not be in school. Those are the children that may need day treatment or day programs for those reasons. And so we really want to focus and concentrate on that population of youth. We understand from data from DCF that that's about 80 youth in the Sedgwick County area. And again, they've, had a recent arrest or, they are adjudicated in the juvenile justice system. We're also working on family finding and making sure as a kin first state that we are ready to be kin first. And so we will be getting some training as well, national training coming to Wichita to train our staff. And this will be all staff to really build the culture of why is this important? And then furthermore, how do we do it and how do we do it successfully to help Kansas continue to increase their statistic of children placed with kin. We're also KPMTO, Kansas Parent Management Training, Oregon. We're making sure we're getting trained and that we will have therapists ready to go. That is required in the contract, and there's several other evidence-based practices we're getting trained in as well, such as team decision making. And then the last thing I just wanted to, kind of talk about briefly are what are some of the early challenges. And I think we're always very honest to say that, transitions are hard. Sedgwick County has approximately 1,300 kids in foster care, which equates to about 1/5 of the child welfare population in Kansas. So it is a bigger removal county with a lot of kids. And so acknowledging that the transition, all transitions are difficult. So what can we do? I think one of the early ones is just the startup time frame. From the time of notification of award until July the 1st. We truly have about a 4-month time frame and not a full 6 months. And so we're working very hard to get this stood up by July the 1st, which it is possible. It will happen, but, definitely trying to condense, that much work into 4 months is interesting. Night-to-night placements is something that we know is going to be a challenge, and I think it's a challenge across the state. I think it's a pretty significant challenge in Sedgwick County. We've heard that number be as high as 40 a night, and so again, don't have solid data around that, but making sure that we have licensed placements for children to go to, and what do we need to do in order to ensure that we do have licensed placements for youth who may have, more behaviors and more difficult needs than other children. Also, we're seeing right out the gate, we've got some difficult to fill positions. There's the popular positions that 100 people applied for, and then there's the less popular positions that no one's applied for. And so what are we going to need to do to make sure that our organizational chart is complete, that we've got all the positions that we need and we have people in those positions? And we're definitely seeing a shortage of licensed staff. And that's concerning to us as well at this point in time, just the number of exceptions that currently are on file for staff that you would hope would be licensed. And then, our job descriptions required licenses. And, so we're really kind of, looking at that. And there seems to be a shortage of licensed staff at this point in time. So I will turn it over to you all and see if you have any questions for me. And again, thank you for the opportunity to present about the transition underway in Sedgwick.
Okay, great. Thank you. And again, thank you for lunch. I don't think we're going to ask any questions right now. We need to get back on schedule. It was kind of my mess up to let everybody free till 12:30. But now you know who they are, and you can catch them individually. Are you going to stick around for the rest of the day? Okay. Okay. Next up, we have Secretary Howard. Good afternoon.
Thank you, Madam Chair, members of the committee. I'm glad to be here with you today. You have my testimony in front of you, and I know you asked some particular questions about um, some of our recent contract procurements that we've awarded or that are in progress, as well as some follow-up from the interim committee. But with your indulgence, after I go through that, I'd also would like to make some comments related to Dr. Sanders' presentation this morning. I think it fell right in line with some of the kinds of data that we usually provide to you in our presentations that we actually didn't include this time, but in terms of some of those by the numbers things. And I just wanted to make some comments on some things that he said this morning. I know you may have some questions about that too. So our testimony this time is more of a narrative testimony. There were three procurements that you asked for updates on: family preservation, foster care, and the child welfare information system. So first on the second page of the testimony has to do with our family preservation contracts. Um, we've had family preservation in place statewide since 1997. Actually, in the early days of privatization, family preservation was expanded to a statewide service, and for many years, it was our only prevention service until Families First came on board just a few years ago. But again, family preservation focuses on stabilizing safety supports for families. It provides an array of services to meet family and child needs. They can range from low intensity to high intensity, but the focus is families who have one or more children at risk for out of home placement, or in the case of a pregnant woman, risk of out of home placement after birth. We awarded new family preservation contracts in December that will be in place beginning July 1st. Those are 4-year contracts with an optional renewal for one additional 24-month period. We received proposals from 5 agencies, 3 of which were the existing contractors to manage family preservation. And our awards actually continued our existing family preservation contractors. You can see on the map who those awards were made to. And again, they're the existing family preservation contractors. You can see TFI out the Northwest and the Southwest, DECA in Wichita and the surrounding area, Cornerstones of Care in the Southeast and Northeast, the 2 green colors, and DECA also in the Kansas City area. We did not really make a lot of changes in the scope of work in our family preservation contracts and award process. We did make a few adjustments. We had previously had a tiered system of referrals where we tried to categorize a service intensity level, a tier 1 or a tier 2 at the time we made a referral. We've moved away from that in the new contracts. We really found that didn't necessarily work that well in the context that, our worker might have they only knew the family for a brief period of time and were making that assessment. And the needs of the family might change over the course of that case. We also didn't have other prevention options at that point, which might be options that we now have under the various Family First contracts. We did not make any changes to the contract outcomes, but we did add in an incentive and penalty schedule similar to what we do within the foster care program. We also just made some changes related to clarity in terms of, what referrals make sense, including families that just need continued support through case management, families whose children are experiencing truancy issues and at risk of entering foster care, and then the ability to make referrals for more than one family household in situations where we have a child who may be residing with 2 different relatives at different points in time with some of those shared sort of custody arrangements. In terms of the number of families served, the new contract awards estimate about the same number of families that we had served statewide in fiscal year 23, but less, particularly in the Wichita region in the new contract. The annual budget set at $12 million, which is what the budget for family preservation has been for a number of years. I might note that during the budget process right now, both houses have at this point added an additional $1 million, which would help us then then to allow more referrals in the Wichita region should that sustain through the budget. We've got a couple of charts on page 3. I won't go into those in any detail. I didn't put it on this document, but I did just want to remind the folks, in terms of the kinds of outcomes that we get from family preservation. For example, in fiscal year 24 to date, 93.5% of children in Tier 1 maintained at home with their family. About 82% of those referred in Tier 2, and very, very high safety numbers, 98.4% across the program. So again, it's been a successful program for many years, and we're glad to continue. And again, we made those awards to the existing family preservation contractors. The second awards you asked us to speak about related to the foster care case management providers. We announced those awards last month in February. They will be in place from July 1, 2024 through June 30th, 2028 with options for 4 additional 1-year renewals. So 4 years with an option to renew year by year up to a possibility of 8 years. As you can see on page 4 of the testimony, we have a map in the middle. The existing contractors were awarded their existing regions except for Area 7. And as you just heard, we did award Wichita Area 7 to Ember Hope. So we would now have 5 case management providers instead of 4. So again, what that means then is for St. Francis Ministries, they will continue to have kind of the western regions, that Area 1 and Area 2. Then you would have, again, Ember Hope in that Area 7, Sedgwick County. TFI would continue to have Area 8, and they would continue to have Area 4, so kind of the bottom right, center and right of the map. And then moving up into the Kansas City area and Northeast, you have KVC with 2 areas, Area 6 and Area 3. So, and then Cornerstones of Care with Area 5. So again, existing contractors in all of the catchment areas except for in Sedgwick County with Ember Hope. This does also mean that no single case management provider has responsibility for more than 2 catchment areas. We're very excited about the awards, and particularly about the award in Region 7. I think we talk a lot about data in this committee and about some of the characteristics of data within Sedgwick County. And so the ability for this contractor to focus just on that county, I think will be very, very important work. And they had some really, I think, impressive innovations, some of which they just spoke to you about. There were a couple of other things that we were also very impressed about in their application as well. So again, those are who we made the awards to. In terms of changes in scope of work, there were some adjustments that we made. I think probably the most significant one to share with this committee is lower caseloads. And we've talked about caseloads in this committee before. We've talked about Council on Accreditation standards. So these new contracts require meeting Council on Accreditation standards, which is essentially caseloads of 12 to 15 children in foster care or kinship care, 8 children in treatment foster care. Now, Cornerstones of Care was already following those standards, but the remaining child case management providers were not. So again, this is significant. The current standard has been 1 to 25. So the ability to have those those lower caseload standards, I think is very significant. We also built some things into the contracts that we had done kind of separately, maybe through other provider agreements or separate contracts. For example, funding related to the special response team, which are those specialized staff related to youth who run, positions related to accelerating adoptions, and support to manage regional youth advisory councils. So again, we had supported those through separate awards before, but we felt like it was important to build it into the scope of work of these contracts. We also updated our contract outcomes with national, federal, child and family service review data measures, and also with outcomes from the from our class action McIntyre lawsuit settlement as well. And again, many of those are the very measures you were hearing this morning from Dr. Sanders. But we actually have 17 outcomes in the foster care contract that we'll be able to measure on and report on with regard to safety, permanency in child time, placement stability, mental health, things like that. We also continue to have an incentive and penalty schedule that targets certain of those outcome measures and practice improvements that we've also again built into those bid awards. So again, our total increase in costs of the new contract is about $20 million, all funds. You'll see that reflected when you see some revised caseload estimates, probably during the omnibus session. The fall caseload reflected the current contracts. And again, the primary impact on that change was that deliberate reduction of the caseload numbers. So again, that's the foster care. And again, happy to, as we report in the future, happy to report on, all those outcomes and to share all those by provider. The third contract you asked about, procurement, is still in process. So I will be a little bit more deliberate in my words here, but we're very close. This is the new Comprehensive Child Welfare Information System. And I was actually just thinking about CWIS as Ember Hope was talking about some of their data challenges during this transition, and the fact that when we have the CWIS system fully operational, all of those things from all of our contractors would actually be in one centralized system, and we would not have the kinds of transition challenges that were just referred to. But just as a reminder, there's 5 legacy systems that support child welfare programs at DCF: aging mainframe technology, obsolete languages, unsupported operating systems. And so we've been in the process of securing a new system. There are 3 specific RFPs that have been out on the street related to this IT project. The biggest is the design, development, and implementation. And then there are 2 accompanying pieces. So the design, development, and implementation, or DDI, that's the largest RFP. And that's really the entity that will be working alongside us to actually develop and implement that new system. There are other supporting contractors who help us to review project performance, make sure we stay on schedule, and then also to do quality assurance to make sure that the state gets the system that was contracted out. And again, these are common add-ons when you do a large IT project like this. We were given a permission from the Division of Purchases to share with you the bidders on this RFP. So on the design, development, and implementation, we had 11 bids. You can see those on the middle of page 6. I won't read all those out. It starts with Forward, E-Systems Inc., Tata Consulting Services, Accenture. You can see that list of those 11. We are moving forward very well on this RFP. We've completed rounds 1 and 2 of vendor presentations and reference checks. We have narrowed the field to 3 finalists. And we've also been looking for other ways to kind of streamline the timeline. For example, this has to be a federally approved information system. The Federal Administration on Children and Families has agreed to shorten their contract review from 60 days to about 20 days when we get the contract to them. So right now we are at the point of best and final offers. And so coming up in the next couple months will be that final technical review, Department of Administration approval of an award letter, and the like. So again, we're very close. I would expect by sometime in April, we should be able to announce to all of you the vendor that will be the CWIS vendor. And again, the other two facets related to the CWIS procurement are also moving along, the quality assurance and the independent verification and validation pieces. So again, we're very close. On page 8, I actually give you kind of a procurement timeline for each of those CWIS related contracts. At the very top is the one I spent the most time on, the design, development, and implementation. And I guess the other thing I would say about this, we don't have a selected approved vendor yet, but I know that certainly in all of our discussions about CWIS, one of the obvious areas of focus has been, how long will it take to really get this operational? I can't give you that full detail today, but what I can tell you is we wrote the RFP to ask for agile solutions. We told our vendors that we really needed to replace our fax system as quickly as possible, and we asked for those kinds of solutions. So again, what we do know from the bids is that folks have proposed various kinds of agile methodologies. So I can't tell you today like what might roll out first or in what sequence, but I can tell you that we expect to be able to roll things out, and we're not looking to like wait 4 years to have a big bang. It's important that we're able to begin to make progress in this area. So, and we're very excited to be where we are, and I would expect again by sometime in April to be able to announce the successful vendor for the CWIS program. The next set of items that you asked us to talk about related to some of the interim committee recommendations. I think there were 4 items that we were asked to address from a DCF perspective. I might say we kind of address these from what we know as DCF. I think some of these areas are a little bit broader, and there could be other agencies that have some additional information. For example, the first item had to do with what the state is doing regarding fetal alcohol spectrum disorder screenings. So what I've shared with you on page 9 is just some of the information from our DCF policies regarding substance use and fetal alcohol spectrum disorder screenings. So as part of our policy, in our policy and procedure manual 5030, you can see various assessments related to substance use. And if a child is referred for out-of-home placement, a screening regarding fetal alcohol spectrum disorder shall be completed. I think that some other agencies, for example, KDHE, could talk more about some of the broader public health work in this area if you wanted more information about this. I also shared on page 10 just some activity of some of our partners. Seeking Safety does work with their outpatient behavioral health program to get a diagnosis of fetal alcohol syndrome if there's a need. And their program has specially trained staff to do an assessment. And they use a particular model called the Oregon model for those assessments. And while DECA doesn't administer fetal alcohol screenings through their specific program, they do make the referrals for it when it's needed. So again, I think KDHE might have some more information more broadly on the public health, but that does tell you what's going on, at least in the child welfare program. You also asked us in the interim committee report to talk about the needs of children in homeless encampments. So on page 11, 12, and 13 in particular, Just giving you a sense of the kinds of partnerships and collaborations that we have in place with local partners across the state. And I would say, I mean, there is a heavy use and referral to local organizations for support and assistance for families. We do partner regularly with a variety of charitable organizations, including Catholic Charities, church alliances. And we do use some flex funds that we have within our family services budgets, sometimes to provide temporary housing, deal with the utility issue, things like that. Those are fairly limited dollars. Some of our regions have had more ability to use that funding than others. But we give some specific examples. For example, in Topeka, we work really closely with the Topeka Rescue Mission and what's called Impact Avenues. Our staff go out to assist families to apply for benefits, at the mission. We're engaged with the task force on homelessness. So again, we do what we can within our limited resources to assist those families with food, rent, maybe a limited hotel stay to try to avert that. Again, we use family services dollars, and then there's a portion of our childcare budget called social service childcare that we can sometimes use in when there's a risk of homelessness. And again, similar pieces as you look at the regions. There's different resources in different parts of the state locally. So we collaborate with those local partners with some of the efforts that they have in place, some of the funding that they have in place. So for example, in some areas of the state, there's some lease and rent assistance that some local agencies have through some specific landlords that they partner with, those sorts of things. Our primary efforts, obviously relate to, helping individuals to apply for benefits they might be eligible for. Um, and obviously when there's allegations of abuse or neglect, we investigate those. So again, I have a lot of just examples of who we partner with, the sorts of things that might happen on a short-term basis to try to assist those families struggling with homelessness. Also connected to this issue, we were also asked to report back on what policies are in place amongst utility companies to avoid terminating utility services when children are present in the home. And I actually thank Andrea Warnke on my team for making outreach to the KCC, to a number of organizations, and to a number of specific utilities. I think we found what we thought we would find as we look across the state. There are no specific policies in place to avoid terminating services to homes with children present. Um, Most of the entities said this is really due to the fact that they don't collect this kind of information. They don't have that kind of resident child youth information due to privacy concerns. We do know, of course, that utilities that are subject to the cold weather rule under the Corporation Commission, there are periods of time when when the temperature is at a certain level, when utilities won't be shut out. But again, that doesn't apply to all utilities, only those that operate under the rules of the KCC. So we've given you some examples here, but the bottom line is there really aren't any specific um, exemptions related to there being a child in the home that's part of any utility policies. There might be, for example, the city of Wichita has like a critical needs category where if there's like a doctor statement, they can give the customer a 48-hour notice before disconnection, things like that. I think that probably more has to do with someone's relying on medical equipment, things like that, oxygen or the like. So again, yeah, and if you have more questions about that, I'm sure the utilities could provide more information on that. But again, that's kind of what we anticipated the response would be. The last thing you asked us had to do with grant funding available in the state for nonprofit organizations to support children with disabilities. I might remind you that in the last legislative session, you provided DCF with $1 million to support youth with IDD services to help to prevent the risk of entering foster care. And we provided those grants to Families Together, which is a statewide nonprofit that does a lot of work with families of youth with IDD. And so they're doing work across the state on that behalf. Obviously, we also have resources within our foster care budgets and with our providers. We didn't, kind of survey other agencies. Obviously, there's a number of grants through KDADS that go to those local disability providers as well. Those were the specific questions from the committee, Madam Chair. I also did want to take a moment, though, if I still have some time here, just to talk a little bit about this morning's presentation. So I really, really appreciate Dr. Sanders coming to Kansas. I feel like it's really, really timely and fits very well with a number of things we've really been talking about with this committee or in other avenues for a couple of years. Um, I thought I might start just in the context of the front end. Dr. Sanders talked a bit about, the issue of like the definition of neglect and how does that look different. One of the things I know that we've brought to this committee a couple times in recent presentations, and this also came out of the placement stability work group, how wide that front door is in Kansas. But we know not only do we have the issue of the definition of neglect, but the context in Kansas statute of having the FINA category in terms of families in need of assistance, which some of the neglect categories that Dr. Sanders talked about today in our statute sometimes fall in that category. And I know we've provided you data before that would show that, about half the kids who come into care for those non-abuse neglect reasons. And then also sometimes because of the way they come into care, if they come in, for example, through police protective custody, we sometimes don't get the chance to offer those front end preventative kinds of services. So there's certainly are a lot of pieces that we've tried to do, right, just as an agency and a state as it relates to kind of those front end pieces. Obviously, as he recommended today, really trying to leverage family first. And I think we've done a good job of that. I think some of the additional work that we've done at DCF to, for example, work with school systems. Dr. Sanders talked about, one of the ahas from COVID was, well, gosh, schools are the biggest referrer, but really not very many of those kids actually ends up with an investigation or entry into foster care. So we've talked to you before about some of the agreements we have in place with school districts to kind of help them kind of transition to think about themselves as mandated supporters as well as mandated reporters. And we've helped to fund some staffing in those schools that can really play more of an outreach role to help those families connect with local resources. I think the recent investment in family resource centers in terms of those community-based entities, again, kind of helping folks at that front end. I would say, just in terms of that wide front door, you've heard us talk about, kind of the Iowa, the 4 questions model. But Iowa is one of a number of states that has made changes in their statute in recent years to try to reduce that front door. I think we've looked at Iowa, we've looked at Michigan, a couple of other states. They take different pathways. Sometimes they have the court make different findings. Sometimes they've changed the definition of neglect. Sometimes they've required certain things to happen, say, for example, for youth of a certain age, if it's not an issue of abuse before they could come into care. And so, again, we've been more than happy to pull back out some of that data and information if the committee has interest, because I do think that there is some value. We've made a lot of progress by practice. For example, with the 4 questions from Iowa, I think we talked to you last time about some of the work happening with DAs and even some court systems to kind of ask those 4 questions before bringing a child into care. But our statutory framework itself, has not changed. So I think that's important, in terms of some of those front end pieces, and we would be delighted to talk more about that. The issue. I was really glad Dr. Sanders talked a lot about the issue of the time that youth are in care. I mean, that is really, I think, one of our biggest challenges and one of the areas that we need the most focus on is how long kids stay in care. We still always talk about permanency and child time, and that child time is different than adult time. And there's no doubt that kids are in care too long. I mean, some strategies, obviously, that we think are having an impact. One is the focus on kin or relative placements. We think that does have an impact on reducing time in care. Second, for some of those older youth, we're really excited about Soul. And thank you for working the bill next week, because we're very excited about what that can mean about youth who might have otherwise languished in care and just aged out, and their ability to leave care earlier. But I do think that there's also value in looking at other kinds of statutory possibilities. And we had our attorneys do some work a while back. I think actually it came out of a conversation that had happened in your committee, Representative Kincannon, this session, that had to do with just the timeliness of court hearings. And one of the things we found was that an awful lot of courts across the country, an awful lot of states across the country have changed their statutes to require permanency hearings to function more frequently. They might require it to happen in 9 months or 6 months. Sometimes that depends on the age of the child. In Kansas, that first permanency hearing within 12 months, and then at least every 12 months after. Courts can do it sooner, but there's no requirement that they do. So as we look at what might be consistent in those states across the country that have some of those shorter periods of time and stay, and we do think one of those common factors is that more frequent court hearing. And as I said, it can look different in some states. Some states have done what they call like baby courts or infant courts, and they have very frequent court hearings for those youngest children. Again, thinking about what does permanency for that youngest child mean. So getting to what that permanency is going to be for that child, and knowing sooner whether or not reunification is an alternative. So again, we put together a little bit of information on that. I think for your request, Representative Humphreys, a few weeks ago. And again, we'd be happy to talk more about that. I think there's some real value in that. And I think the permanency piece will be a real focus of the judicial summit, the joint summit in April. So we're excited about that. The Dr. Sanders also talked a bit about younger kids, and that kind of really, I think, got our ears percolating as well. I think Kansas has done some good things there. We put an internal policy in place in 2019 or 2020 that whenever we had a report related to an infant under age 1, that even if there wasn't a finding, that we make a mandatory referral for like parent skill building services. Could be parents as teachers, could be other home visiting. And again, we can't force the families to do that, but we require that our staff make that referral. You, of course, have done the care exam piece. I think that's also another significant, important piece there. But our brains were kind of spinning on the whole piece about the public health nurse and 2 people and those things. And so we were already thinking about whether or not there might be a way we could do a pilot, and perhaps in areas of the state where there's high rates of child death, where we might pilot that kind of a program with some existing resources, where we might partner with public health in some fashion. So again, I think that focus on younger kids is very, very important. But I also wanted to give you credit for some of the things you've already done in that regard. Just a tiny piece, I think, Madam Chair, you had asked about that spike, the COVID spike about on that one chart. What that chart really shows is less about entry and more about the fact that for a period of time in there when courts were not functioning, people weren't leaving. So if you look at our other charts, you'll kind of see that the entries, we've seen this consistent reduction in entries, but I think that spike on that proportional chart has to do with the exits really just kind of halted for a period of time there. So just some clarification there. So again, I really appreciate Dr. Sanders being here, and I would really, I mean, I totally agree with him. I mean, just the ability to know your outcomes, focus on data, what we're trying to accomplish as a state, and all really being on the same page on what those things are, looking at that common data over time, knowing where we're making progress, knowing where we want to make progress and how we want to focus both legislative resource and agency resources. So again, I could talk more about things he talked about for the rest of the day, but I'll let you ask me questions instead. So
Okay. Excuse me. Well, thank you for being here, Secretary Howard. Um, I'll start with one question. I'm pretty sure the committee has several questions for you. But when we're talking about 2 years to permanency, that do we have any in the new contracts? Are there any incentives for the providers to for a shorter time to permanency?
Within the new contracts, and we have identified certain outcomes, and we have outcomes in the contracts that have to do with time to permanency. So, I mean, for example, the outcomes. Oh, 35.2% of children have permanency in 12 months. Just under 44% have permanency in 12 to 24 months. And then we have a couple of other permanency measures like that. We also built that into the incentives. And in fact, we decided in this contract to weight three outcomes more heavily as we looked at incentives or penalties. And one of those did have to do with the whole issue of permanency in 12 months is one of the ones that we're weighting more heavily in terms of penalties and incentives with our contractors. The other ones have to do with that placement stability rate and the timely mental health screens. But so yes, we did try to put more emphasis and focus on that initial permanency piece.
Okay. I've got a question from Senator O'Shea, who is now joining us via WebEx.
Hello, thank you. This morning, the doctor mentioned that in Kansas, we have a lot of people who call the hotline, but then those don't become cases that that they need to look further into. And he wondered if there's a lot of resources going towards that. And I was just curious if you had a rough estimate of how many full-time employees we have for that kind of like resource hotline, and why do you think Kansas has a higher percentage of reports that then don't go anywhere?
I'll have to get back with you on that number. I don't have that in front of me in terms of how many staff we have related to that function, both the call centers and the investigation. In terms of the substantiation rate, I, and this is a little bit speculation on my part, but a lot of this data connects together. And I think that a lot of the issues around the lower substantiation rate also have to do with how broadly we define the populations in Kansas. And I think some of the work that we've been doing, with kind of mandatory reporters, and we want people to report abuse. We also want them to know that there are other avenues if they just have concerns about needs that a family has besides the hotline. So again, I can't speak to what might be different in some of those other states, but I do think that has one part of why that number shows up lower in Kansas.
Senator Falscadell.
Thank you, Madam Chair. Caught me swallowing. Secretary, thank you so much. I have some questions I'm going to email you, and you can have someone perhaps respond. One of them will be a follow-up on how you think the new law, performance-based contracting, is working, and how KDHE comes into play when we are placing children or looking at the description that Dr. Sanders gave if a social worker goes out to a home um, and or for foster parents when they are being considered, is KDHE still, do they have to approve the housing prior to? That would be one question. You can email me back, but just two quick ones, Madam Chair, is so grandparents' rights in a situation where there's a child and one grandparent wants to provide for the child. However, let me take it like this. So the maternal grandparents have a child, the mother's parents. So what rights does the father's parents, the other grandparents, have, and what's a resource they could go to get that help?
I think it depends what the situation is. I mean, if we're talking about a foster care situation, I mean, there are a couple of provisions in our law, and I'd probably let the revisor speak in a little more detail about that than I, that relate specifically to grandparents. There are also some other pieces about relatives. I mean, one resource for them might be, talking with Kansas Legal Services and the kin contract that we have with them. But again, they do have certain abilities to intervene in the court and things like that. But again, every situation is so unique. It's hard to. I'm happy. I'd be happy to look into a specific situation more deliberately.
Thank you.
I might also say, Senator, on the other question you asked related to KDHE, I just wanted to remind the committee that DCF actually does the licensing of foster homes. KDHE does the licensing of daycare, but we actually do the licensing ourselves of foster homes. So,
and Madam Chair, then the final question here. So, do we actually have a foster care to adoption? So I know this, the Representative Humphreys, we talk about the children that are in foster homes, and then we don't want them to linger there after 2 years, and so permanent placement. So a lot of times there are situations where the bio mom just doesn't complete everything on that list in a timely manner within that 2 years, and then the foster parents get attached, and then we're trying to place in the adoption part. Is there a mechanism within DCF where it's kind of funneling, so foster parents or foster care for a limited time versus foster parent to adoption? Thank you.
yeah, thank you for the question, Senator. There's a lot of facets to that. I mean, just sort of basic data, right? And about half of our adoptions are to foster parents. About half are to relatives. There's about 3% that's not either of those. But so just under half are to foster parents. You know what? I mean, it goes back, I think, to some things we were just talking about earlier in terms of the point at which the case plan changes from reunification or reintegration to adoption, and then what happens at that point. What we don't have, of course, are some of the things that, like Representative Humphreys was referencing earlier, some of the legislation that you've talked about in the last couple years that might look at issues related to any preference for foster parents, either based on the age of the child, the time with the foster parents, those things. Or those issues or issues related to attachment. So in examples where we're then looking at adoption, there are a small number of cases where that ends up in a best interest staffing. And those tend to be the ones you hear about. That's a very small number of our adoption cases. Most of those, they go on a much more natural path to either stay with that foster parent or go with a relative. But there are some instances where that a decision has to be made between those. So, and we don't have, like I said, some of maybe the criteria that some other states have in those statutes related to foster parents.
Secretary Howard, while we've been in this meeting today, I mean, uh, I get a lot of people contact me with anecdotal stories, and I'm going to tell you about one here that I just got while we've been here. And not for any kind of gotcha thing. This is more for our education. How should this have been done? A disabled infant in foster care hasn't had a court hearing in 10 months, but moving to unsupervised visits in the home with positive drug tests. How should that? I mean, how does that? So, how does that happen that they don't have a hearing in 10 months?
Yeah, I mean, obviously we have to look into more details.
Sure, I know
We'll
that there's
do that,
details,
of course.
and I'm just asking for for the learning process of how the hearings are set up.
Well, I mean, in terms of the actual court hearings, I mean, the judges decide the frequency of those hearings. Again, within our statute, there has to be a permanency hearing every 12 months. They they often tend to happen more frequently, or there may be reasons to have follow-up hearings and the like. Um, but but for example, decisions to change the kinds of visitations, those things, some of those things would require court approval. Some of those things may have had court approval maybe at a previous time, and maybe circumstances have changed that led to this concern. But again, I think I'd have to look into the details there. But again, I would also hope that in that kind of circumstance, that's certainly the kind of complaint I would want to hear about through our customer service function, as well as obviously it would be an appropriate complaint to make to the Office of Child Advocate. So
that's where all mine go.
Yeah. Yeah, but I think both. I mean, I certainly would want information on that because it's the sort of piece that we can certainly look into right away as well.
Good.
So,
Representative Howerton.
Thank you, Madam Chair. I was excited to see that the caseloads were getting lowered, but in light of what Amber Hope was just stating earlier, how are we going to lower caseloads if there's not people to work that? So do you have a plan for that or an idea about how that's going to work?
That's a great question, Representative. I mean, that's really tough, right? I mean, in the sense of the ability to hire. I think we continue to try to work with our partners. We continue to have conversations with educational partners. Looking at the possibility of engagement with students for them to come into the child welfare, but I don't have a great answer to that. I mean, I think it is a challenge to be able to access that appropriate workforce, and I think it's something we all just have to kind of keep working on together. The criteria for the workforce is broader than it used to be in the sense of what qualifies with regard to those staff and the various kinds of degrees they can have. But I think it's something I'm going to be looking at closely with those higher standards to see what challenges our partners are having in meeting that, what successful strategies are, what kinds of incentives might be useful in that regard. Yeah.
That's all. There it goes. I'd like to follow up. Just say, I mean, it's an incredibly frustrating world. These workers are doing hard work anyway, and then if they're already feel like they're failing, that's not a good environment in which to work, which doesn't lend itself to more people coming into this.
Yeah, it's a little catch-22 there, right? Because the lower caseloads would certainly help. And I know you're going to have a conversation later today about some of the can coach work and work around some of the value of that strong supervision, what that means to workers. But again, I think we'll have to monitor this closely. We know there's a lot of competition for the workforce. Just with the different hats I wear. We certainly have competition. With mental health, child welfare, and other sectors for our limited workforce.
So on the last question, just to follow up, what exactly is the process for investigating these claims? Is that defined anywhere that I can read? Or like when a claim comes in, who investigates, how long, are there time frames required?
Sure,
What does that look
absolutely
like?
there are. Yeah, we have very focused policy around that. I'd be happy to share that with you and with the rest of the committee. I think probably been a while since we've talked about that in the full committee. But yeah, right. So when a report comes in, we have investigators in our offices to go out and do that. And we have specific timeframes, and those timeframes could be same day, depending upon the allegation that's made. Those timeframes could be 72 hours, or those timeframes could be 7 days. It depends on the kind of allegation that's being made, really the risk of safety of the child. So again, we have that, and we capture data on all of that as well. I'd be happy to provide that follow up though.
Yeah, and as always, if you could provide that to Judy, then she'll
Right.
share it with the committee.
We'll definitely do that.
Senator Gossage.
Thank you, Madam Chair. Just real quickly, because I know we're trying to stay on schedule here. We keep saying, our length of stay is too long, but what is it?
Yes. So right now, if you look even at what Dr. Sanders shared, if I can get to the right chart here. You can, what we can tell you easily is the proportion of children who reach permanency within a specific timeline. For example, what percentage reach permanency in 12 months? What percentage reach permanency if they've been in care 12 to 23 months? What I heard this morning, which I thought would be valuable data, and we were kind of nodding our heads saying we could do that. I think it would be valuable to show you data on the length of time to permanency based on the case plan goal. So like for youth who are reunified, how long did they stay in foster care? For youth who are adopted, what's that time frame? Because I think that makes things more clear than, well, 39%, are in foster care 12 months or less, this amount. But I think until you break that out to see, is it that adoptions are just taken 7 years? I'm making that number up, obviously. Don't is it? I think that would help us a lot to look at some of that data together.
I think we would all agree that'd be very helpful. And finally, there was in Carrie's report for the child advocate, there was a full page regarding Social Security cards and getting the birth certificates for a child, and this being a deterrent in enrolling them in school. Has that improved?
With regard to the birth certificates, we entered into an MOU with Department of Health and Environment, and so we've just recently implemented some new processes. And so I would say stay posted. I don't think I have data yet to show me if it's improved. I hope it will. They're targeting some specific resources at KDHE to work on just foster care or kids in custody issues. So again, we'll report back. I know that I'll be hearing from my case management providers and other partners if we don't see an improvement there.
Thank you.
But we definitely, and we worked hard to enter into that MOU to create some greater urgency around providing those documents.
Representative Humphreys.
Thank you, Madam Chair. Just a couple of or maybe 3 questions. Did you, the list that you gave us, it was super helpful about the needs of children in homeless encampments. I didn't see anything about education in all of that list. And I don't know, how do we deal with the education needs of children in homeless encampments?
I'm probably not the best person to ask that question, Representative, but I do know that there are specific provisions within education law related to the education of youth who are homeless. And so I don't know the answer beyond that, but I do know that there is extensive work that's done in communities related to youth who might be absent from school due to homelessness, transportation of those youth, those kinds of services.
Thinking the bus doesn't stop at the homeless encampment, but I don't know what happens. I just thought of that, but I know in last week in the Child Welfare Committee there's a school in Wichita, the McAdams Academy, but that's children that are in foster care or who have been expelled from school. So I'm just curious, I don't know if anybody knows that's listening, but that might be just helpful for us to hear about. My second thing is, I've heard that there was.
Humphreys.
Oh yeah, I'm sorry. Someone has.
Maybe we might have it. Tanya, did you have something to
I didn't
add?
see you stand up, Tanya. Yeah.
Terry, sorry about that.
Yeah.
Thank you, Tanya Keys, Deputy Secretary, Department for Children and Families. We do have data on our length of stay and foster care on our public website. So the length of stay for all children in care, when all children, the average number of months is 24. If they're leaving for a reason of adoption, it's 40. If they're leaving for a reason of being reintegrated, the average number of months in care for those children reintegrated is 10 months. But for all children, across all types of permanency, it's 24 months. That's an average.
Okay. All right. Thanks.
Well, that is super enlightening.
Adoption issue.
Yeah.
Okay, exactly.
Yeah.
Tanya.
If I may. Okay. So I think there was a governor's budget addition about that was proposed about a family finding organization or something, technology or something. I'm wondering if you know the status of that and if that's.
Yes, thank you, Representative. Yes, this is the governor issued a budget amendment to allow the agency to procure a family finding system. You might recall that last year the legislature actually put some funding in the budget and the governor vetoed that funding. We had the occasion to meet with some vendors over the summer and fall related to that. So what this would do, and this would be a this would not be a long-term IT project like CWIS is. This would be um, a tool that would allow our partners, would allow us, but primarily our case management providers, and to be able to have a technology that helps them, sort of track the work they're doing around family finding. I mean, you sort of think about all the different times in a case where it might be important to know who their relatives or kin to that youth are. And also to be able to then report back on reasonable efforts to the court. And the systems that are out there have pretty nifty tools about, doing geneograms not on a piece of paper, those kinds of things. But again, they would think it would be a very valuable tool. At least one of our partners in the state already uses one of the tools that's out there. I believe it is currently in the budget for both the Senate and the House right now. So,
thank you. And then just one last question. So this whole the situation with the attorney versus a guardian ad litem, that we've been hearing, that we just had a hearing on that bill in judiciary, the House Judiciary, but everyone keeps bringing up that funding is an issue, but there is 4E funding for child welfare, but that so far the state of Kansas is not drawing down any of that 4E funding. Now, Colorado, we hear is, and it's going to either jails or attorneys or something. And so when I've asked, well, who's supposed to do that? Some people say it's the counties, and other people say, no, it's DCF, or no, it's, and I would love if you have any insight on that 4E funding, if you could help us follow through with that.
Thank you, Representative. This is a new option that came about federally a couple of years, 2 or 3 years ago. I lose track of time. It would be DCF as the state agency. There would be a process we would have to go through, fairly extensive, with what we call our cost allocation plan with our federal partners. The caveat I have on that is, and I may not be saying this well, and my deputy secretary might come up and correct me, but the way that not all youth in foster care are 4E eligible. So it's for a percentage of youth and a percentage of this. By the time you get down to it, we're probably talking about, knocking this off here. What percentage did we come down to, Tanya, that we probably would be able to draw with regard to this? If I can defer to Tanya.
Thank you, Secretary. And thanks for the question. When all of the math is done, it ends up being about an ability to draw down, about 10% of the total cost. So, for example, and I'm just using a general number because it's easier, right? If there was a legal service, an eligible or applicable legal service that was eligible for the 4E match, let's say it was a legal service that cost $1,000. Well, in Kansas, the percentage of children who are 4E eligible is 23%. So $230 of that $1,000 legal service would be eligible to be able to put towards the 4E. Of that $230, 50% of that would be covered by federal partners.
So 50.
It's 50. So $115 would be available then to reimburse for the county, presumably, or the court jurisdiction who would be actually paying that legal service fee. So $115, being able to get reimbursed $115 out of a $1,000 service, it's about 10%. It's not exact, but that's with our assumptions and our understanding and interpretation of the federal instruction. That would be the administrative process to pull down the 4E. The net yield is about 10% of the total cost. We would be able to, folks use the term drawdown, but it's really a reimbursement. We would be able to be reimbursed by the federal government. Does that help?
Yeah, that helps a lot. And yeah, just maybe keep investigating, but that was really helpful. Thank you.
And I'll just say, I mean, on a larger scale, we have terrible reimbursement rates for Medicaid, but what we get, but what we pay the providers, it still matters. It puts a dent in it anyway. Other questions? Representative Howerton.
Just to follow up on the question I asked, is there, if those providers don't meet those caseloads, is there any kind of clawback, or is there a fine or penalty, or what happens to that?
We would start with more like a corrective action plan, and there'd be kind of a process where they would kind of let us know the steps they're taking to try to meet those caseloads. It would be a while before we'd get to like trying to do a clawback. I'm a realist in this, in the sense of, as you talked about, we do have a workforce crisis, but I don't think that's a reason to not say that we want to have appropriate caseloads in our child welfare system. So.
Representative McDonald.
Thank you, Madam Chair. I had two things. As far as Representative Humphrey's question about homeless kids in education, I'd point you to the McKinney-Vento program. It's a federal program that enables students experiencing homelessness to have as little change as possible in their educational program. So there is a requirement to provide transportation so that they can go to their home school. So there's a lot that we're already doing. McKinney-Vento is that. But my question has to do with, we keep hearing about a need to increase, speed up the court system portion of this journey that children are on. What is the bottleneck? Do we need more judges? Do we need more attorneys? Do we need different processes? Help me understand that a little better.
I don't think there's one single answer, and I also don't want to put it fully on the courts, because in the context, that's why when we talk about, for example, having hearings more frequently, some of that may have to do with whether or not on our side we're doing the work that needed to happen for that case to move along. I guess I would kind of leave it to the courts and the Office of Judicial Administration to speak to maybe what their resource demands are. I certainly know that some of the proposals that we talk about could mean that they might have greater resource demands if we were talking about things like speeding up court hearings and things like that. But I think like I said, we really are all in this together, and I think there's improvements that can be made on all parts. But I do think the more frequent court hearings places additional accountability on all actors in the system. I'd say it that way.
Thank you.
Yeah.
Okay, Secretary, we're going to wrap that up, and thank you very much for being here and answering so many questions. Next up, I'll call on our CAN coaches. We have Elena Hanna and Natasha Santiago Mason. And bye. um, those House members may have heard their presentation before, but welcome to the Oversight Committee. And I'll let you go ahead and talk about what you do.
Thank you so much, Madam Chair Cannon, Vice Chair Gossage, and thank you, Natasha, Ranking Member Owsley, and members of the committee. Thank you for inviting us to speak about the Can Coach program from Children's Alliance of Kansas. Slides. My name is Elena Hanna, and our Can Coach team just comes with a broad range of experience working in child welfare. I have almost 20 years experience of working in various roles within the child welfare system. Katrina Hinkle, who is actually just completing one of our training programs, who is not here, has over 10 years of experience working in various roles, including working directly with individuals, families, and groups as a therapist, and also leading integrated health initiatives through programs developed at a federally qualified health center.
Hello. My name is Natasha Santiago Mason. Thank you, Madam Chair Concannon, and members of the committee. We know this is a little bit of a repeat for several of you. We're going to try and summarize and kind of skip through a little faster than what we had prepared for today. So bear with us a little bit. So we are a team of 4 from Children's Alliance of Kansas. We are very passionate and eager to pave the way in leading workforce initiatives that enhance the quality of services we can bring to Kansas families. We all come to you from a wealth of knowledge, experience in foster care, adoption, permanency, and that comprises our team. So next slide, please. Oh, next one. One more. Thank you so much. So we're here to talk to the committee today about the benefits of 2 training programs that we provide at Children's Alliance of Kansas. As you likely know, Children's Alliance delivers programs that serve the entire child welfare community in Kansas and beyond, so that regardless of what child and family well-being agency a person works for, they carry their skill set from one agency to another. Our first program is Can Coach, using knowledge to inspire action. It's a skills-based coaching program with a focus to administer a specific coaching model that emphasizes quality supervision, impacting all levels of the workforce, giving them an effective strategy to enhance quality service delivery and program improvement. Our second program is called Resilience Alliance. It's a 12-week course to agency administrators, supervisors, and direct line staff. The aim is to educate child welfare staff and agencies about the symptoms of secondary traumatic stress and help them identify tools so they can mitigate its negative effects. Can Coach and Resilience Alliance have stood as consistent and relevant interventions across the public and private child welfare agencies the past 3 years. However, as we have pivoted and transitioned from the University of Kansas to Children's Alliance of Kansas, we're serving additional workforce populations. We're growing by expanding to child placing agencies and psychiatric residential facilities staff. Next slide, please. So we really are lifting up here that our work has been born from a lot of collaboration. We have a list of providers up on the screen, and it's really just been a cross-agency collaboration, bringing child welfare experts representing diverse regions of the state in alignment with one another to create a more effective and supported workforce. So we are creating a peer support network in our programs because it's uniting supervisors and administrators from both small and large communities, along with new and seasoned staff. These programs offer a unique training experience for participants as they engage and learn from one another. In the 18 plus years of my work, I nor my fellow CAN coaches have ever experienced trainings that bring together such a diverse group of staff from multiple agencies in one place, training and practicing their new skills together. CAN Coach alone provides 18 hours of shared learning for admin and SUPs over 12 months, while Resilience Alliance provides 12 hours of learning space over 12 weeks.
It's an important time to collaborate. As you heard from Dr. Sanders today, I hope some of that resonated, and I've heard that theme throughout today a little bit. Because when we problem solve in one-way discussions, what I mean by that is when information is only occurring within our own teams, our own departments, or our own agencies, our workforce is not adapting or growing to meet the greater needs of our communities. In addition, in today's economy and with the mental health crisis occurring with our youth, the everyday challenges for families has vastly outgrown what one agency can serve, making collaboration even more crucial. In addition, multiple human service provider systems are facing a workforce crisis, with high turnover rates causing negative impact on children and families. Next slide, please. In 2022, the Quality Improvement Center for Workforce Development brought child welfare leaders from 22 states together. Key themes found from this collaboration were identified as putting our workforce in a state of crisis since 2020. High job expectations, managing high caseloads with low pay, not enough staff for quality work to be delivered, extreme levels of stress on supervisors, resulting in, quote, unprecedented turnover among supervisors, unquote. The compilation that multiple human service systems are struggling with the workforce, such as healthcare and educational systems. In addition, administrative expectations have, quote, overtaken the ability of the child welfare workforce to work directly and successfully with families, unquote. Finally, a lack of peer and supervisor support combined with trauma experienced by staff are also contributing factors to turnover. Right now, the Casey's Families program estimates that we are on average about a 30% turnover rate in child welfare. The Child Welfare League of America published in 2022 that the averages were between 23% and as high as up to 60% across the nation. So quite a variation there. But we want to lift up this in comparison. The optimal annual turnover rate for healthcare and human services sector is at or below 12%.
I know this committee is familiar with probably some of the impact that this has on families. Research acknowledges that the abrupt change in workers is a loss with negative impact on children and families. I'm going to share just a brief personal story about how supervisor turnover affects families. So I found when I was working as a child welfare supervisor that I added a new staff to my team after a supervisor left the agency. 1 month later, the staff that was involved in a very complex case left the agency. So 1 month into my team obtaining this case, we didn't have the original caseworker nor the supervisor that had the case knowledge of this case. This created a burden for the new worker to manage the complex issues involved with the case at the same time of learning their job. They were very new to the agency and really meeting the needs of the 30 children that were on their caseload. This included multiple staffings with community partners because of the needs of the children and family and accessing resources. There's also a complex legal case that we were involved in with, due to the parents that involved the media as well. I was in charge of not only knowing and managing the parents' legal case, but also the child's legal case and working with our legal department. During the time the children were in care, we found that the family had had 8 different caseworkers, and there's no doubt in my mind that this turnover in this case delayed the permanency for this children and this family. So the Casey Foundation reports the staff turnover has been associated not only with more time in foster care, but more placement disruptions, more incidents of maltreatment, and even reentry into foster care. We cannot continue to work in this way, and we must place focus on supporting and maintaining quality and well-trained professionals. Next slide, please. So the coaching skills learned in Can Coach are used effectively to support the implementation of agency initiatives and really enhance the practice skills of the workforce. It is important as leaders, supervisors, managers, and employees, we model these skills so they can be replicated with the families that we serve. So in our program, we continue to support the professionals as they practice these skills in real time. So again, personally, I have experienced what 25% of learners will transfer into practice. In 2015, I actually attended a training to learn about coaching. I watched a demonstration from the trainer. I was able to practice and receive feedback during that time. But as soon as crisis hit, as soon as I became overwhelmed, I went back to some old habits. And there was no follow up to ensure that I continued to use those coaching skills. What makes our program unique is that we support the workforce over 12 months by providing job embedded coaching and follow up. At the same time, participants are coaching their own staff so that 90% of professionals will transfer their new skills into practice. Next slide.
Try and slow it down a second. I was really hammering it out at first. Sorry about that. So let's take a look at what this looks like. We've been talking about Can Coach program, a coaching program. What's this mean for someone and how is this different? So our skills-based coaching program means that every professional begins with a brief overview of the Can Coach model and skills by completing a short online module. They then engage in 12 hours of interactive online training with other professionals from throughout the state. Remember that we stated, Elena lifted up that 90% of people learn best when they apply their learning through job embedded follow-up and coaching. Can Coach embodies this by assigning each participant their own Can Coach who will continue to support, coach, and follow up with the participant, making this an exclusive attribute of this program. Following the initial 12-hour training, participants continue their learning in collaboratives, where leadership skills and peer support are furthered in a 90-minute virtual setting, sharing space and practicing coaching with each other. So what would this all be without supervisors coaching their staff? The last step is this is where the transfer of learning and the implementation of coaching within supervision and beyond is solidified. We have some quotes, but due to time, I'm going to go ahead and move through that.
So our Can Coach skills-based coaching program provides a framework to professionals and how to engage with families no matter the worker's years of experience, title, or educational background. You can see 6 basic skills listed here. Just to give you a brief introduction to each skill, presence means your focused attention. Listening means using active listening and not just hearing what a person is saying, really listening to what maybe their body language is saying and as well. Reflecting, clarifying is using the person's words to reflect your understanding of their content. Questioning is really asking real questions to hear someone else's idea or approach to a problem. Feedback is giving feedback that is really connected to the issue at hand, and accountability is setting clear action items together. Participants are trained to use these key coaching skills intentionally and strategically, promoting a culture that can increase the employees' critical thinking skills. This is achieved by their supervisor asking more questions rather than telling, resulting in the worker developing their own solutions to problems and addressing the need for them to feel supported and satisfied in their work performance. Remember, these skills are also strengthened by the job embedded coaching. One example of how I observed the positive impact of job embedded coaching was when I began to coach a supervisor as they struggled to implement coaching into their practice. They came up with powerful questions to use during supervision with their staff. And during the next time that we met, they discussed how coaching helped them engage with their staff and other departments within their agency. For example, the supervisor said they used questions to ask what others were really thinking about a situation. And their plan was to continue to be curious and use more open-ended questions. They said that coaching really had a positive impact on their communication with their staff, other departments, and even working with foster parents. So using these coaching skills intentionally when meeting with this supervisor led to them coaching their staff. This was a great experience for me to see how the supervisor was using these trainings to affect their practice.
So now I want to share a few core concepts that we emphasize in our trainings and are rooted in all Kansas child welfare practice, regardless, of what agency a professional works for. Participants discuss strengths-based engagement. Strengths-based approach is goal-oriented, strengths-focused, and capacity building. meaning the interaction is meant to build upon the resourceful skill sets of a person. Our workforce is engaging parents and youth in tough conversations in a way that enables and empowers clients' decision making, embodying the phrase, "nothing about me without me." Trainees also take a deeper dive around ongoing family assessments, including risk and safety assessments. CanCoach understands that formal and informal assessments are core elements of Kansas child welfare practice throughout a family's involvement in child welfare services. Professionals need a strong skill set to ask powerful questions to obtain accurate and relevant information during a time of crisis for some families. This is more than just checking a box in an assessment form. I believe this kind of correlates with some of the things that Dr. Sanders brought out this morning as well. Although multiple core concepts are discussed in CanCoach collaboratives, that's the last we will mention here is relative kin connections. Families are honored as experts in their own lives and recognized as being essential in providing healing and lifelong connections. Participants learn and practice to coach their staff around this topic by exploring possible solutions to barriers that are keeping children from being placed with relatives and kin. Next slide, please. The second program offered by CanCoach is a Resilience Alliance program. It's a 12-week course held 1 day a week for 1 hour over Zoom, delivered to agency administrators, supervisors, and direct line professionals throughout the state. It's designed to educate child welfare leaders and workers about secondary traumatic stress and train them in techniques to mitigate and cope with these symptoms. To demonstrate how powerful the symptoms of STS can be, I would like to share a personal experience. The year before I transitioned into being a CanCoach, I received a phone call to turn on social media platform and listen as one of my youth I was supervising was in a crisis situation. 24 hours later, I found myself traveling 5.5 hours on a Sunday night so I could be present as the youth woke up from surgery as they had been shot. I had first met this child at the age of 6. They were now 16. Unfortunately, this youth was the third youth that I had worked with over the years who had been shot. It was not until 6 months later, when I was managing the tragic crisis of another child, when I found myself frozen and overcome with grief. I recall being angry and embarrassed that I could not stop myself from crying so I could be there for my team. Secondary traumatic stress is real and it takes a toll over time. It's not the same as burnout. Burnout relates to work-related stress like workload, time management, and non-supportive work environments. Anyone can face burnout. You can work at a bank and experience burnout. My symptoms were STS. I did not know this at the time, but my reactivity to others, including my own loved ones, my avoidance of certain staff, withdrawing, disassociating, and feeling so overwhelmed, it kept me from asking for help. I decided it was time to leave direct service child welfare practice after 15 years. So luckily, I have unpacked my own STS as I have studied and facilitated Resilience Alliance.
Natasha's story really highlights the emotional duress that happens when an individual frequently hears or reads about the trauma experience of another person. So think about a time maybe when you have heard or read about the abuse or neglect a child has experienced. What was your reaction? Maybe you felt sad or even angry. Did you notice an increase in your heart rate? Maybe you began to sweat. Did your muscles constrict? Did your stomach clench? Consider child welfare staff as part of their job. Hear and read about the detailed and troubling events sometimes on a daily basis. Think about the experience of the professionals working in the Protection Report Center. For others, the very nature of their job puts them at physical risk by entering a home in an unknown situation. Either way, with that constant exposure, they may begin to develop symptoms such as trouble sleeping or concentrating, even thinking about a family when they're off the job. Some child welfare staff could become short-tempered with families or avoid answering calls or not asking detailed questions with families that remind them of a traumatic experience they previously heard. Just like police officers and firefighters, child welfare staff or first responders, they are asked to respond to traumatic crisis situations, and as a result, they can start to develop their own traumatic symptoms and reactions. This can lead to a low productivity, increased absenteeism, poor quality of work, and even higher staff turnover. To add to this difficulty, child welfare professionals are not celebrated as heroes, rather, they are identified within the frame of negative news. We have observed the positive impact these programs are having on its participants and the families that they serve. Here's one example. In a recent Resilience Alliance group, we had a prevention and protection staff discuss their hesitancy in attending the group that day. They were feeling exhausted and overwhelmed due to managing a police protective custody case that with the same family. For that day's discussion, the Resilience Alliance concept was reframing, which is just taking a negative situation and viewing it in a positive way. So after the discussions and after gaining support from other direct line staff and practicing the reframing in class, the participant then said that they wanted to go back and reconsider the strengths of the family as they were completing their assessments and to also view the parents' protective capacity. At the end of the session, the participants said that they were glad that they attended and because it helped them to reinvest in working with the family. They said that it helped them to slow down and to think, allowing them to see the positives in this situation. Next slide, please. So these programs have had an impact on the child welfare workforce in such a significant way. We want to share just some initial numbers that were provided by the University of Kansas partner. Now remember that they are still collecting and evaluating the data from both of these programs. So to date, 1,027 child welfare professionals, and this includes administrators, supervisors, and direct line staff serving families, have experienced both programs. We have had 404 supervisors enroll in our 3-week skill-based coaching program. And of that, 331 have completed the initial training. That is an 82% completion rate for the supervisors providing direct services to Kansas families. During our trainings, we have heard multiple times that supervisors desire to be coached by their administrators. This feedback was brought back to administrators, and they themselves had wanted to attend the program. So starting this week, we began our first coaching cohort for agency directors and program administrators. And Natasha and I both heard firsthand that administrators were eager to implement coaching into their practice as they have observed the positive impact on the skill sets of their supervisors and direct line staff. For our Resilience Alliance program, we have had 623 total participants enrolled, with 502 completing the program, giving us over 80% completion rate. Remember, Resilience Alliance serves administrators, supervisors, and direct line staff. We do look forward to the quantitative data that will be provided through KU about the impact of these programs. And in the meantime, we will continue to gain the feedback directly from the participants about how these programs have improved their practice in working with the families of Kansas. Next slide.
So what does Children's Alliance of Kansas hope to gain for the future? Our focus for 2024 and beyond is to continue being a data-driven program. We want to partner and embrace those who can help us meet our goals and sustain this really important work. Currently, our goal is to continue expanding our program delivery to additional administrators and all child placing agencies, including, again, staff at residential treatment facilities. We plan to do that by increasing the number of current trainings we provide, offer new refresher courses to graduated participants, and continue serving our mission through being experts of the Kansas child welfare workforce. To reach that goal, we hope to grow our CanCoach team so we may further explore programming to support child welfare practitioners across the service array. As you have heard today, this issue is no short of I think, it's adding to the problem, right? It's like a cyclical issue. We don't have enough staff, then it affects everything else. So we have all these great interventions, and at the end of the day, they're not going to be effective if we don't have a workforce to implement them. So we want to continue studying that, becoming experts, and seeing what else is available to help our Kansas families. We'd like to leave you from the feedback from one of our CanCoach supervisor participants. At the beginning of CanCoach, I was not eager to attend these sessions twice a week. It took time out of the day I did not have, and I felt after 16 plus years of social work, I did not need more trainings on this. But as always, I joined the meetings with an open mind. After a few sessions, I could see a change in me and my staff. I was allowing them to make decisions without me just giving them answers. Also, giving them 100% of my attention during their time with me, turning off my email, my phone. They enjoyed centering and just breathing for a couple minutes prior to starting their staffing with me. Can Coach made me think and get out of my comfort zone. I learned a lot from Can Coach, and I will be using all of my new skills throughout the rest of my career as a supervisor. I would recommend this to all supervisors. We thank you for your attention, committee, and we're happy to stand for questions.
Okay, thank you for being here. Committee, do we have questions for the Can coaches? Okay, you must have been really thorough. Thank you. Oh, I'm sorry. Wait a minute. Senator O'Shea has a question online.
Yeah, thank you. I loved hearing this. So this is my business is coaching, employee engagement, strengths development, how to be good managers of people. And I have often sat in this committee and thought, how do people do this hard work every day? How do, how on earth do they keep anyone in jobs? And I know retention's a big issue. So I was just thrilled to hear about this program, what you all are doing. So maybe two quick questions. Have you connected with, is this in tandem with
Senator, can you hear us? We've lost you.
She can contact us with the questions that she have. We'll
Okay.
answer them by email if that's okay.
Okay, that'd be great. That'd be great. Sorry about that. Okay, next thing we will move into our reports of the case management and family preservation provider updates. And Justin's ready to go.
I know I'm on a timer. Somebody's gonna.
Well, I just, before you start, I just want to say that I believe the last time we had an oversight committee meeting, there was a request that we let you providers know what we want to hear about, what we want you to report on. And Representative Howerton and I volunteered to do that, but we didn't. And but I have a good excuse. At that time, we were working on Dr. David Sanders being here today, and really thought that we would wait until we heard his message on us having oversight, and then we'll get together and do something for the next meeting. But I didn't want you to think that we were just ignoring that request.
I wasn't going to hold it against you.
Okay, so up first is Justin Horton from Cornerstones of Care.
Yes, thank you, Madam Chair. But I think we did hear you. I think there was some dialogue about retention data. There was some dialogue about report carding. So I think you'll see that certainly in my testimony, if not the others. I don't think I've heard it today, but March is National Social Work Month. So I would like to recognize, Representative Reeves isn't here, but anyone who is a social worker in my agency in the room and the fellow agencies celebrating National Social Work Month. My name is Justin Horton. I am the Chief Programs and Innovation Officer at Cornerstones of Care. I've been doing this work going on 21 years this year, and I've been at Cornerstones for 11 years. If you're not familiar with our organization, we are turning 154 years old this year. We are a trauma-informed organization serving citizens of Kansas since 1999, and we have about 250 team members across 8 offices doing work in 52 counties in Kansas. We sort of describe our work in 3 areas: youth and family support, foster care and adoption, and education. So I did provide you a map. It gets a little busy when you do multiple services in one county, but we provide family preservation in 25 counties, foster care in 3 counties, therapy in 48 counties, behavioral intervention support in schools and homes in 24 counties, and transitional living in 1 county, being Wyandotte. Talking about family preservation, provided you some updated data within the testimony for January and February. Those 2 months, we received 76 referrals. I know you saw the secretary. We provide services in what is still currently the East region. That will be the Northeast and Southeast in the next contract. But just wonderful family preservation work going on in this state, keeping families together. We have a success rate of 98% in those 2 months of January and February for not having kids placed into foster care. High satisfaction results from the clients served, and exceeding the case closure goal. A couple of things I wanted to highlight that you may or may not be familiar with. If you are, thank you for helping with it. If you're not, then know there's some good stuff going on. I meet with my directors. I oversee our 2 directors directly for family preservation. We have supervision every other week, and they talk a lot about housing instability. I think you've heard that today. So a couple of things that my director in the Southeast, who has an office in Pittsburgh and Independence, I just wanted to lift up and say is going really well is some housing crisis counseling through the Kansas Statewide Homeless Coalition, which allows us to get housing crisis counseling along with working with community mental health centers to wrap supports around folks who have housing instability. Then also Aetna Better Health of Kansas has infused some dollars into the state, and they have a grant program that we have directly been able to tap into to pay for things like rent, deposit, and utilities. We have corporate credit cards at Cornerstones of Care, and I approve all the transactions of my director. And what comes through most are things like hotel bills to keep families together and provide some stability. So these 2 programs, in addition to the funds that we pass on to our citizens, has been very good in helping keep families together and not having poverty or housing instability be a reason that people come into care. For transitioning to foster care, we are the provider in Area 5, as you have heard. Last time I spoke before you, I think we had 562 foster kids in Area 5. We are down to 517. I provided you a lot of data around foster care, around staffing, caseloads, retention, and dashboarding. I will let you review at your leisure. We host a lot of people at Cornerstones of Care. I would echo what was said earlier. We're happy to host anybody anywhere in a Cornerstones facility or office if you want to visit. We are getting together quarterly with the Child Advocate Office. I think everyone is, but those have been good touch-base meetings, and we'll be hosting them at our Ozanam campus so they can get a tour of our residential facility and emergency shelter later this month in March. And nobody's given me any time, so that's good. Okay. Lastly, I will close with some outpatient therapy. We started some new work in October of last year. A new funding opportunity came along to do functional family therapy, which is an intense evidence-based therapeutic intervention for youth ages 11 to 18 who are at risk because of their behaviors to enter the juvenile justice system, foster care system. They have behavioral challenges, but this particular funding opportunity allows us to serve those already in the foster care population. So we are the provider in the Northeast, as you have a map on my last page, I believe. So we're actually serving Cornerstones of Care families, KBC families, and St. Francis families. I think to date we are fully staffed, which isn't always easy to say in a therapeutic environment. We are actively serving 21 functional family therapy cases. I've served 23 to date. The 2 cases that have been closed were successful. So this is really geared at stability. So can we minimize the amount of moves that kids have, and can we keep them in family-like settings, keep them out of group care, keep them out of congregate care, which is what we all want. That's what functional family therapy is set to do, and it's working so far, and we're excited to keep doing that work. Most of the time, functional family therapy is done in a prevention way before kids enter systems, but this is a great way to utilize those things. We do see gaps in mental health in Kansas. I don't think that's a surprise to anyone. We are, in my next testimony, I'll talk more about the next contracts to start in July and some enhancements we're going to bring, but we'll be having more mental health services in both family preservation and foster care. And we're excited to do things like functional family therapy. I think you'll hear some data points from my peer at DECA about some surveys they've done around mental health, and community mental health centers do the best they can. They're doing a great job, but I think there's some things that we can do as well to help augment that. I will stop there.
Okay, I think we'll wait till everyone goes for questions because we would bombard you and then nobody else would get a question. Okay, we have Jeanette Owens up next from DECA.
Chair Concanon, Vice Chair Gossage, and members of the ranking member Owsley and members of the committee, thank you for your time today. My name is Jeanette Owens, and I'm the Chief Child Welfare Officer at DECA, where I've worked for the past 20 years in the child welfare program. DECA has been serving Kansas children and families for the past 50 years, and while we serve in the child welfare realm, we also serve substance use treatment disorder, as well as traffic safety, prevention, and research services. I appreciate the opportunity to share today. I'm going to start with sharing my excitement, and it feeds right off of the last conversation about mental health, but sharing my excitement about the new KDAD's policy that will be coming that makes Medicaid behavioral health codes available to non-mental health centers. This is going to address a lot of the barriers that we've been bringing to this committee for the last couple of years. This policy change will impact access for our kids and our families, and it will provide a potential of choice for those kids and families. So many of our kiddos and families have mental health needs, and when we're working with them, reaching that stabilization is a huge point for us to help meet those case plan goals and move forward. Sometimes now, and I know you've heard this before, but I just want to share it. We will get a family preservation referral, and we will work with that family the entire time, and they still haven't been able to get the access to those services that they need by the time our case is ending. And so then we have to determine, are we recommending a second referral, or is that family, we're hoping we'll get those services after we have left working with them. This past month, as Justin referred to, several of the child welfare providers engaged in a brief mental health survey for not only our caregivers that we work with, whether it's in family preservation or foster parents or kinship parents, as well as our staff on where things are at, because we've talked about it for a long time, but we wanted to hear where we were at currently. And the results emphasized the importance of greater access to services. We weren't surprised by that. I think what I was most surprised by, though, was the number of participants that chose to add additional comments. Almost 50% of the participants took time to add additional comments to us to help us understand the need for access to mental health services. Common themes were long waiting lists, lack of services, lots of effort to get any services. And there were 3 comments that I just want to mention. There was lots of comments, as I indicated, but there's 3 comments I really wanted to point out that I think summarized what we're hearing on a pretty regular basis. One caregiver commented, 14 months in foster care and still waiting for services. One staff member indicated, intakes can be done within a week, but services are not available for 2 to 4 months. And another indicated, timely and effective care is rare. These comments and needs are one of the reasons why we're so excited about this new KDAD's policy coming and knowing that it will bring additional resources to a system in an area our families are really needing. I'm going to now switch over to talk about our child placement agency services. And while DECA doesn't provide those case management services in foster care, we do provide the recruitment, training, support, licensing to foster families across the state. We currently serve about 425 foster families. And then I also mentioned that Kansas is at 2,310 foster families statewide. Earlier this month, on March 7th, we celebrated Foster Care Awareness Day. And that's something we've done for the last 5 years. And it's really a day that all of our staff joined together to emphasize the importance of people being aware of the foster care system and those needs within it. We highlighted myths, facts, stories, specific information on our social media platforms, as well as went to 25 different community events that day. We received over 30,000 views on social media and 5,000 interactions. So we felt like it was a very productive day to get out more information. We also highlighted the new Child Welfare in Kansas video that a group of us within the Children's Alliance worked to create to just provide a bigger understanding of the child and family well-being system. And that received quite a bit of attention as well. And what was interesting is it received attention from not only those individuals within the child welfare system, but outside of that too. And then we've got a lot of specific requests to add that video into manuals in different places such as schools, court systems, and our foster parents also very much valued that. So we are excited about in updating that regularly and keeping that moving forward. The next section I wanted to talk about is another positive about new resources. In November, We Can Drive became statewide. And if you recall, We Can Drive is that program that walks alongside kids in foster care, independent living to help them receive their driver's license. To date, we've served over 400 youth, which is pretty exciting. We've had over 257 enrolled in driver's ed courses. We've paid for insurance policies for over 66 or right at 66 kids. And we've supported over 140 in obtaining a license. So that is really excited. Since we went statewide in November, we've had 175 new referrals. So it's been a busy few months. We are fully staffed in that program, and they took off real fast. So it's exciting to see those kiddos already being served. The next service I want to update you on is our post-adoption support services. And this is where we provide respite training, support groups, and in-home therapy services to our adopted families that have maybe adopted recently or maybe many years prior to. We've currently served 54 families. We just finished our first year in January, and we've moved on in this year. I'm really working on that, bringing more awareness. So many families that get to us have expressed, man, we wish we would have known you a year ago or 2 years ago or had this service provided. So we continue to try to up the awareness for that program. I'll wrap up service updates with speaking about our family preservation services. And we provide family preservation in Kansas City and the Wichita regions. We utilize the evidence-based program called START, which is Sobriety Treatment and Recovery Teams. And that is a dyad approach. So each of our families in START receive both their case manager, but also an individual that has lived experience and both been involved in the child welfare system as well as substance use recovery. We continue to get really positive feedback from our families when they're able to work alongside somebody that they know has been in the same place that they've been in and made it out and feel successful. We currently are serving 212 families as of today. And we too are very excited about the new Family Pres contracts that are starting July 1. We're looking forward to some of those changes that the secretary spoke about with the tier system changes and things like that and the new resources coming. So I'm going to real quickly do two other quick things on family preservation. One of the new pilots that we started, and I spoke about this, I think, maybe in August to the Oversight Committee, but we were looking for a new way to engage families to really explain what our services were. And so we have purchased LCD screens to talk about our programs and what we've done in our pilot. And I'll open it for just a second to explain what it does. But it automatically plays the videos for families to hear about what family preservation is. There's 3 sets of videos on there, depending on which type of service we're talking about. And on the back, it has the criteria. So this one says START criteria. And so it explains specifically to that family what type of criteria is needed to meet that service. What we've done is partner with DCF, and we're about 3 months into this, where DCF has supervisors and directors have access to these, and their workers are able to take them out when they're at a TDM or they're at a family meeting of some sort, or if they're working with a family that's resistant to services, and they can take this out and, in our words, hear about what family preservation services are. To date, anecdotally, we believe that it's helping engagement. We're going to continue to look at that and find out how effective they are. So I will leave these here if anybody wants to look at them specifically, but that is one piece I wanted to share. And the second thing I wanted to talk about is I normally try to bring a really positive case to just share kind of where we're at in family preservation and what that looks like. And I'm going to do something a little bit different today. It's not quite as positive, but I think in the long run, I think it really shares where we're at in services. I was on vacation this week, and I received a series of emails, about 5 or 6 in a row, and so I jumped on, and it was two of my staff interacting back and forth with their DCF counterparts regarding a case, and we'd received a referral in Family Pres the week before for a mother that had been utilizing substances throughout her pregnancy. She had had her baby, and the baby tested positive. Our team and DCF had worked together to create a safe spot for that baby to go, in a safe family's home for temporarily, while we worked with mom and set her up for assessments and treatment. Um, Unfortunately, then at the temporary custody hearing, it was determined that family needed to go into foster care, or that child needed to go into foster care for safety reasons. I say unfortunately, but I also bring this case to you because 5 years ago, it wouldn't have been probably on anybody's mind or our thoughts that maybe we were going to be able to keep that kiddo out of care. Somebody that had been utilizing substances and tested positive for a baby often immediately went into care. Today, we're often able to, within our start cases, 95% of the time, I believe, keep those kiddos safe and in home with their parents. And so it was really great to see the emails back and forth of praising each other, of the work that everybody had done. And that mom, one of the statements the DCF worker had said that was so impactful to me was that mom has not ever had anybody advocate for her like that she got to see in court that day. And that felt really good of where we're headed as a system is a really great place of keeping families together, wrapping around new services to provide that care. I'm going to finish with talking about staff retention. In February, we were able to host our 3rd child welfare conference for our staff. We brought in multiple national speakers and provided different types of resources to those families. This was the 2nd time we provided every meals to our staff, which is where we can drop ship actually meals to their home. And it's a unique thing that staff, we tried last year and staff really appreciated. They're busy, they're doing a lot, and they seem to really value when one week of the year they have cooking almost done for you. You have to do some of it. We're glad to be able to provide that again this year. Another retention tool that I've shared with you guys before and I wanted to share again was our neuro-optimal systems. We have been using them not quite a year yet, but continuing to monitor the data from the number of hours being used by our staff. And if you recall, those neuro-optimal systems are advanced neurotechnology that allows to train your brain to perform at peak function. And what we find so spectacular about this technology is it meets people with where they're at. So if we have a staff member that is really struggling with multiple different things, it meets it meets them with where they're at. And if we have somebody that's at peak performance and just wants to spend time training their brain to do better, it meets them where that's at. And so we have really valued this resource, and it's allowed a new tool in our toolbox, especially more so when we have staff that are in a struggling place. Maybe they've experienced some sort of trauma while providing services or even in their own family. So our retention rates for January, we're at 96% for that 1 month. For the fiscal year, we're at 74.5%. So we continue our focus on staff retention and workforce needs. So thank you for your time, and I'll stand for questions at the appropriate time.
Okay, thanks, Jeanette. Angela Hedrick with KVC.
Afternoon. Chair Concanon, Vice Chair Gossage, and Ranking Minority Member Owsley, and members of the committee. My name is Angela Hedrick. I'm Vice President of Operations for KVC Kansas. KVC is the current foster care grantee for areas 3 and 6. And we're honored to share that we're going to continue to serve both of those areas when the new foster care contracts begin on July 1st. My written testimony includes numerous data updates, but I'm going to try to just give some highlight a few topics in the interest of time. We've updated the Child Welfare System report card in my testimony with the most current published outcomes. That chart shows for children in foster care in Kansas, rates of maltreatment are significantly lower than in state fiscal year 2018. This is largely due to reduced strain in our system by safely maintaining more youth at home. The number of youth in out-of-home care has reduced by over 1,700 youth during this time. This is the lowest the number has been since 2014, and there is a 40% decrease in the number of youth entering care each month. Investment in prevention services supports this progress. Our testimony also includes a chart that specifically identifies the number of referrals and permanency types for KVC. We continue to locate placement for all youth. Since our last joint committee hearing in October, we have experienced 12 instances of overnight office stays. In half of these instances, placement was located, but the youth refused to go. Regarding caseloads, as mentioned previously, we are excited about the opportunity to have reduced caseloads starting July 1st. Our testimony does include what our current caseload ratios are. And in addition to reduced caseload sizes for staff members, we are also able to improve our supervisor to staff ratio to 1:6 starting in July. Currently, we're averaging 1:8. Regarding workforce retention, we ended fiscal year 23 with an 80.9% employee retention rate, and we're currently at 87% retention for fiscal year 24. This is compared to a typical child welfare retention rate of closer to 60%. We continue to collaborate with Gallup on employee engagement strategies, and recently our KVC engagement champions for each subsidiary were able to participate in a retreat at Gallup headquarters in Omaha, Nebraska. We were able to hear insights from Gallup leaders regarding our most recent Q12 survey results, and we were also able to spend some valuable time strategizing as a group for our 2024 engagement planning. And then as a complement to our employee engagement efforts, KVC supervisors continue to participate in the Can Coach training cohorts that we just heard about. And then we're also excited that this opportunity is being opened up to additional departments, including our child placing agency and administrators. The Can Coach curriculum and the monthly Boss to Coach training support sessions that are offered by KVC engagement champions together provide a vital professional development and leadership growth opportunities to those that are in a supervisory role. KVC also incentivizes our leaders to participate in the Can Coach program by offering a salary increase for each phase that they complete of the program. While we're awaiting the next settlement audit, with reads scheduled to start in May and end in June, we've implemented our own internal audit practices that replicate those completed by the settlement auditors. So our testimony includes the 2023 settlement audit snapshot, which hasn't been able to be updated yet. That snapshot won't be updated until the 2024 settlement audit report is available. But then we also included an additional chart that provides internal measures of initial mental health and trauma screens completed within the first 30 days. That additional chart demonstrates that the samples that we have pulled internally from November to January are all at 100%. With the new contract starting July 1st, we're going to expand our outpatient department's role in completing those assessments. Currently, that department is only completing initial assessments, but starting July 1st, they will complete all follow-up assessments as well. This is expected to improve the timeliness and the consistency throughout the life of the case, and it will also narrow the pool of assessors, which will help ensure that all assessors are fully qualified. After assessments have been completed, it's then our responsibility to ensure youth are connected to the appropriate services in a timely manner. As mentioned in others' testimony, KVC recently collaborated to disseminate a survey of caregivers and child welfare professionals regarding access and experience with mental health services. 43% of caregivers reported having to wait 2 to 4 weeks for a youth's first appointment, and 30% reported having to wait more than 4 weeks. Caregivers have also reported a trend in experiencing a significant amount of time between a youth's first appointment, which would be their intake appointment, and their second appointment, which would be the first time that they actually meet with the assigned therapist or service provider. As an adoptive parent of 4 children, 3 of which who have endured foster care, my personal attempts to access services for my children through my local CMHC align with the results of that survey. After requesting services through our local CMHC, we were able to get an intake within 3 weeks. However, following the intake, it was another 4.5 months before case management services began. We were able to successfully have in-home case management services over the summer, but when the school year began, the CMHC case manager didn't have availability to meet our daughter outside of school hours. We advocated with the school to allow the case manager to see her there, as she was experiencing significant behavioral struggles within the school setting. Despite the school already having a service agreement in place with the local CMHC to provide services within the school, they denied our request to have the case manager that is assigned to our daughter go into the school. This caused another disruption to service. The lack of coordination of services between the school and the CMHC is extremely disheartening and defeating, even for a family who is very well connected and knowledgeable about how to advocate for needed support. KVC believes that all Kansas families deserve access to timely and quality mental health services. Legislation and funding that supports an increased number of providers and will help families access these supports before mental health needs escalate unnecessarily should be our priority. Looking forward to the upcoming year, the rest of 2024, KVC is excited to be designing a program implementation plan focused on an organized, systematic approach for creating a network of support for placement providers. This network of support will provide intentional, reliable relationships amongst caregivers with a caregiver leader who is compensated to be able to provide support, organize social events and learning opportunities, and provide respite to the families in their network. We look forward to sharing more about this at future committee hearings. Thank you for your time, and I'll stand for questions.
Okay, thank you, Angela. Matt Stevens with St. Francis Ministries.
Good afternoon. Chair Kincannon, Vice Chair Gossage, Ranking Member Ousley. My name is Matt Stevens. I currently serve as Vice President of Advocacy for St. Francis Ministries. As many of you know, St. Francis Ministries operates a continuum of child welfare services in Kansas. I'll go through what that looks like and how that's broken down. Updated some data. There's a few things I obviously will kind of point out as we move forward. So we are the case management provider currently for areas 1, 2, and 7. That includes all of Western Kansas and Sedgwick County. Through that work and the continuum of care, we employ 1,177 Kansans to provide services or support of those services to children and families. I've updated these numbers so there's a breakdown of where those employees are currently working and what service that they're supporting. Recruitment and retention efforts remain a priority for us. We continue to evaluate competitive benefit packages, ongoing compensation reviews, as well as participating in the National Child Welfare Workforce Institute to train and recruit more child welfare workforce. Moving on, our Family First prevention services include FCT and Seeking Safety. We are very proud of the fact that we continue to see very good results with children remaining in the home a year after those services are complete. FCT right at 86.8% and Seeking Safety at 90%. And again, that's a substance misuse evidence-based practice, and again, seeing very phenomenal results as it applies to that. Those results remain unchanged from the last testimony. Obviously, it's fiscal year 23 for us. I did break down the newest permanency types and the types of, the types of permanency we're seeing. Reunification remains high in the services we're providing. So 54% of the children who are referred to us eventually go back home. Adoptions that are finalized make up 25% of our permanency type. And then aging out is at 13%, guardianship at 4%, and other. And so again, we've got some work to do. We need to continue to have positive permanency options for children. And so I want to thank you for continuing your efforts as it relates to SOL. Having the youth really design and have a big impact into that is very important as it applies to hearing what they've experienced and what they think would have been helpful for them. Moving forward, you'll see area 1, 2, and 7, the number of children in services, again, at the beginning of this contract and where we're at currently. We've seen a major dip in areas 1 and 2, like most of the state, and area 7 has seen an 8% increase, leading to an overall drop in about 20% of children in our service area needing foster care. The caseload ratios, which we've talked a little bit about today, you'll see where we're currently at. Those will be changing, with the requirements of the new contract that starts July 1. We continue to focus on hiring that position to really make sure that we've got manageable caseloads and supporting the workforce doing that work. Missing and runaway youth, we've talked about that at different times during this committee. We had 40 youth that were currently missing or had run away on February 29th of 2024. That accounts for about 1.4% of our population, which is what other systems experience. And then our failure to place status. Since the last time we were here, we've actually had really good results. November, December, and January, we had no children who slept in the office. And then in February, we had one youth who had placement but refused and ended up sleeping in the office on 4 different occasions. We also have multiple residential. So we have a QRTP and a PRTF. We continue to provide services to that level of care. And then we operate a CPA. Again, we've talked before that we continue to see a decrease in the number of licensed homes. And the biggest drop is by the number of inquiries, just that we're seeing as a system and as a state. And as discussed before, we continue to experience higher than average number of kids in foster care. And so we're currently at under right around 5,900. Again, I think we've done a lot of good work to continue to decrease the need safely. But if we use national average per capita data, we would only be at about 3,380 children. So again, we need to find ways to close that delta. And so I really did appreciate Dr. Sanders' testimony early today. I think he gave us lots of different ideas as to how we can kind of start impacting that. Really paying attention to the ratio of the entry to exits. Him saying and me agreeing, we've got too many children in care for too long. And so how do we shorten what should be a temporary solution in foster care? It should not be indefinite. Obviously some of those things that he looked at, really focusing on that 0 to 5 year range because they have very limited ability to protect themselves. And then more frequent court hearings also, as seen in other systems, can be beneficial. With that, I will stand for questions at the appropriate time.
Thank you, Matt. Tabitha Gibson with TFI Family Services.
Good afternoon, Chairwoman Concannon, Vice Chair Gossage. Thank you so much. I knew it, and then I lost it. And Ranking Member Owsley. I am Tabitha Gibson. I am the Senior Vice President of Permanency Services with TFI Family Services. Most recently, you would have heard from Rochelle Roosevelt. Rochelle has gone on to bigger and better things within our organization, so I am here to visit with you today. Thank you for the opportunity to present. As you know, TFI Family Services is a statewide organization. We provide services including foster care, licensing of foster homes throughout the state. We are also the family preservation contractor in Western Kansas and the case management provider in South Central and Southeast Kansas, all the way up north to Franklin and Miami counties. We've been serving children and families in Kansas for nearly 60 years. a little bit about myself within the context of that so that you know that my experience in child welfare. I've been in child welfare for nearly 30 years, about 20 of that with TFI Family Services. I have also served for a children's advocacy center and also a federally qualified health center within that 30 years, all serving children and families in the state. I've also been an NRKIN foster home, having served a child that was a classmate of my daughter's at one point. So I have a unique variety of experiences within our system that I hope I can share with you and maybe be able to help answer some of the questions that you would have. In the interest of time, I want to touch on a few things just to highlight. Our family preservation program in Western Kansas, our Tier 1 program has served 149 children so far this fiscal year, and our Tier 2 has served 167 Tier 2 families. We are currently meeting expected use allocations in both Tier 1 and Tier 2 families. But more specifically, I want to talk about our case management outcomes, especially in the context of some of the things that we've heard today. I'd like to note that our out-of-home population served by TFI Family Services right now is 1,157 youth between our two areas, which is down about 20% from when we started in 2019. So that is a combination of efforts between DCF and the work that they've been doing on the prevention side and the work that our staff have been doing in achieving permanencies for children and families. So far this fiscal year, we've achieved about 396 permanencies for children and families, the majority of which are reunification. Close to 60%, somewhere around 57, 58% of our children this fiscal year have been reunified with their families. Related to our outcomes, some things I wanted to just spend a little bit of time on. TFI is currently overall meeting the permanency in 12 months outcome in our current contract. As of earlier this month, we were at about 41.3% of our children achieving permanency within 12 months. We've been putting a heavy focus on timely permanency. We are also meeting the outcome around permanency for children who have been in care for 24 months or longer, which is another topic that kind of came up today. However, we still have work to do on that in between. So for those kids that have been in care longer than a year, but less than 2 years, we are not currently meeting that outcome and is an area that we want to continue focusing on for all the reasons you've heard today. Another area I'd like to highlight is the improvement in placement stability for TFI. I think since Rochelle last presented, we have brought our placement stability outcome down even further, which is a positive in this situation. We are closer to meeting that outcome than we were the last time. And one of the things that I want to point out there is that while we are improving placement stability, we are also preventing failures to place. So that is a challenge. TFI has had 2 failures to place this fiscal year. We have not had one since October. Both of those failures to place were older adolescent youth with physically aggressive behavior and complex mental health needs, which we were able to find placement for the following morning. They each had one night in an office. Since October, we have not had any. We've always focused heavily on preventing failures to place. It's been a philosophy of ours since we started providing case management services in 2019 that kids don't sleep in offices. The improvement in placement stability has helped, but that focus on preventing failures to place has not come without its toll. And what that is what you've heard from everyone today about staff retention. So it is resulting, we serve rural Southeast Kansas and rural South Central Kansas. What that means is that oftentimes the services that our kids need are located in Wichita or Topeka or Kansas City, and less so in the communities where the children actually live or where they're from, which means our staff are transporting kids to acute hospitals or psychiatric residential treatment facilities 2.5, 3, 4 hours away. Putting our staff on the road late at night often. All of these things, while we believe very seriously in the prevention of failures to place and that kids should not be sleeping in offices, we understand that it's coming at an impact on the well-being of our staff. So what do we do about that? That's something that we have been working on as an organization to try to address the workforce, recruitment and retention. You've heard the struggles from everyone today about the difficulties recruiting qualified staff, meaning qualified case managers, social workers specifically. Those are areas that we are continuing to focus on and will continue to focus on. We are grateful for the opportunity to continue providing case management services in Southeast and South Central for the next 4 years, and that will be an area of focus for us as we continue. So given that, you have all of our other data in my written testimony, and since it is 3 o'clock, I'll stop there, and if you have questions, I'd be glad to see them.
Okay, thank you. Committee, do we have questions for the providers? Senator Gossage.
Thank you, Madam Chair. This is for DCCA. Thank you for being here. I was looking at this second paragraph, access to new resources. Could you explain a little bit more about the wide range of issues we have raised, and it's regarding the policy and the Medicaid codes? Could you tell us a little bit more about that?
Yeah, I sure would be glad to. Thank you for the question. We know right now that there's a significant need for mental health services, to access to get it quickly, timely, and then long term for our kids and our families that we're working with. And so the KDATS has been upfront that they're looking at changing that policy July 1 that would open up some of those behavioral health codes to other providers in addition to the mental health centers who now would be CCBHCs. And so having those services open to other individuals that want to provide that access, we think would allow our families to have more availability to those services, which they need.
So then what you're saying is that DCCA could be able to offer some of the services and be compensated for that, which they're not able to be compensated currently. Is that what you're saying?
DECA could, as well as other entities outside of child welfare.
Okay. And do you see a cost to the state for that? Or do you see this as just a transfer of they were getting services over here and now they're getting services over here, so it should be the same? Or what do you see as for a cost to that?
I really appreciate that question. And I'll give you my opinion if that's okay. It's not adding additional people to Medicaid, and so there wouldn't be additional people getting services other than the fact that if there's more resources available, more services available, individuals that need it now, that can't get it now, should be able to get it. So I believe without having any expertise to this, long term, we are spending so much money on people that are not receiving the services they need. And if they could get that in advance, it should save us money in the long run and certainly should be better for our families and kids.
Thank you. And thank you, Madam Chair. And I know there are lots of different questions, so that'll be it for me for now.
Thank you.
Representative Humphreys.
Madam Chair, so I have a question for Tabitha. This is a kind of just very specific question. Then I have a couple, maybe a general question, but your PRFT, it's a PRTF. Sorry, I'm looking, there's a typo in here. It says that you have a 49 bed, but you only have 23 youth that are there. Is there not a waiting list? Is there, tell me about that, because we're so much hearing about lack of available services and things. So
I think, and I don't want to speak for our other partners who have PRTFs, but a lot of the struggle there with capacity in Kansas, including for us, is the staffing of those facilities. So while you might be licensed for 49 beds, if you don't have the staff to maintain the ratio of staff to children in the placement, you cannot fill those beds.
And so is that true for you? You only have staff for 23? I mean, do you have a waiting list or?
I can't answer for our specific PRTF in terms of a waiting list. There is a waiting list of youth in Kansas in need of a PRTF.
Yeah. Okay. Thank you for that. And then I have a general question, and it has to do with TFI, but not so much. That we got written testimony that I don't know if you saw it from a private citizen about an experience they had with TFI. Maybe you would want to look at it. It's super heartbreaking. It's kind of the insistence of the case management provider to make sure a child goes with a biological father when he had said he didn't want the child, he didn't want to do that, but he went ahead and said, okay, I'll take the placement just to get him off his back. So, I know there's two sides to every story. I'm not asking you to explain that one, especially since you haven't read it. But my question is, it's something we're dealing with all the time, is this kinship and so on. And if you look at our statutes, kinship is defined as, a in placement is defined as placing a child with a family they have an emotional tie to. That's what the statutes say. But I do believe there's policy that has to do with a non-relative kin. Everyone has this non-relative kin thing. So you don't have to answer this. Maybe somebody else wants to. But my question is, when is DCF and maybe the the case management providers going to understand that family or kin can be that foster families can be part of that, because y'all know that's part of one of my biggest issues. And I see a policy overtaking what our statutes actually say about kin. And so I would like for anyone to answer or just come back to us at our next meeting or, something. But it seems like reading this and then hearing that you have policy of non-relative kin, it just doesn't match up. And so I don't know if you would like to address that. You've been in the field for a long time, so you may have some thoughts about it.
So I think, speaking for me and speaking for TFI, the non-relative kin policy really speaks to someone having a close emotional tie to the child or the child's parents. And so that's something that we evaluate when it comes to the connection between whoever that potential NR kin is and their relationship to the child or the child's family. For me and for the agency, I don't think that it is that we're unaware that there is a bit of a push and pull between how we evaluate NR kin, foster homes, relatives, and the balancing that comes with all of that. We try to teach our staff to do what is best for the child in a given situation. And sometimes that means that we're going to select a foster family. Sometimes that means we're going to select an NR kin, and sometimes that means that we're going to select a relative. We do strongly believe that relatives and NR kin, which is someone that is known to the child and the child's parents, from the start of the case, is usually best. However, that's another outcome that we're continuing to strive to meet. We are not at 50% relative NR kin placement yet. We have been a couple of times, but we haven't maintained that. There's a variety of reasons for that. That may be because we've evaluated the potential relatives and NR kin that came to us at the time of referral and determined that they were not appropriate. It may also be that there just weren't any at the time of referral, but it is a constant balancing act. And I would like to hope that as a system, we are constantly considering the connection between the child and whoever their caregiver is as part of our decision-making process, even if sometimes we have to make a decision that not everyone is on board with.
Yeah, and especially at the beginning of the case, of course, relatives are the preferred resource. There's no doubt about that. But then at some point, I think it changes. And then if I just may ask one more question, I'm not asking for an answer to this at all, but I'm going to bring up something that I think is very controversial, that I'm asking maybe DCF and the case manager providers. I'd like to know what your policy is on children who are transitioning their gender. I'd like to know what you all have put in place as far as parental rights and taking children out of the home, and how you're advising foster families on that issue. If I could ask Madam Chair, just at some point that we are able to get that information and understand what your policies are on that.
Okay, that's not a topic that we've addressed before,
No.
so maybe we can ask you to bring that
Later. I mean,
later, or if you want to email it, but we can talk about it at our next oversight committee meeting too.
Thank you. Thank you.
Senator Representative Howerton.
Thank you, Madam Chair. And this is just a follow-up with, this is for DECA, sorry. A follow-up with Senator Gossage. So when you were doing those surveys, did you ask the CMHCs before the surveys went out for any input, and have you shared the results with them?
Thank you for the question. I appreciate it. We did not ask them for input on the survey, and I think as we continue to do surveys, we always learn more. And so there's some questions we would have done differently. We put 2 to 4 weeks together, and we probably would separate that out because 2 weeks seems a lot more reasonable than over a month and things like that. And so that would be a piece in doing the next set of surveys. We do plan on sharing the results. We brought these results in front of many of the child welfare providers at the Children's Alliance meeting last Friday. And that was the topic of discussion of where to provide those and how to provide those as we move forward. Thank you.
Senator Gossage.
As we discussed earlier, we will be taking final action on the SOL bill next week. And so I would like to hear from anyone who would like to speak on it. How would this help with placement and especially for kids that are aging out?
I will probably defer to some of my CMP colleagues. From our child placing agency view, we always have worked under the presence. The more people working with our kiddos, the better. The more people that are there to provide them support, the better. And so we're excited about what this could bring to our kiddos. And then I'll defer to
Anybody want to volunteer? Matt.
I'll volunteer. I mean, it's just one more permanency option. And so it really allows that child the opportunity to pick who that person would be. And so your question about how it will impact placement stability would be that those kids would no longer be within our system. They would be in a permanent setting outside. And so, again, anytime you open up a new option, it allows opportunities for people to kind of, in this situation, choose who they want to be with. The system then supporting them in that decision.
Thank you, Madam Chair.
Anybody want to add anything to that? You guys are quiet today. Okay. Any other questions? Do we have any questions from WebEx? Okay, Representative Ousley.
Thank you, Madam Chair. And I was going to ask this question of the secretary, but anybody could respond. In the new grants with the caseload compliance with Council on Accreditation, if I count right, that puts 23 max caseload. And if I read that correctly, that's per child, not per family. And that seems substantially lower in some situations of examples given, and maybe at best in others. With the new foster care grants, will this put a measurement out there across the providers that we measure caseloads equally or consistently, maybe is a better word.
Anybody? Oh, Tanya.
Thank you. Tanya Keys, Department for Children and Families Deputy Secretary. Thank you, Representative Chair Kincannon. If I understand your question correctly, yes, using the Council on Accreditation caseload standards that they set forth will create consistency. We did question and answers during the RFP process that ends up becoming part of the contract so that everyone was clear that these are the standards to follow. I may not have understood your number of 23, but how, and we answered this in the RFP, the interpretation of, it's 12 to 15 children in foster care, kinship care, and their families. And then we interpret this and by the way, that would mean up to 8 children in treatment foster care. So if you do have, if you're serving a number of families, and sometimes in the course of a placement, you know, a child or youth might enter a treatment foster home, that gives you the ability to adjust and have a lower total caseload. So it's not 12 to 15 plus 8. It's really thinking about within the context of how many children you're serving, be cognizant of those children or youth who might have higher needs and be receiving care from a treatment family foster home setting. And in those situations, just be cognizant of that, that the total number would need to be lower. If you are dedicating a case manager to children and youth who are living in treatment family foster homes, then the limit would be 8. But we interpret these standards so that they can adjust and accommodate based on a child's needs. So that if you do have, if part of your families within your entire caseload are receiving or residing in or with a family foster home that's a therapeutic family foster home, that's just a consideration that you need to take into account to make sure that your total caseload can adjust for that. But we know that therapeutic family foster homes uh, maybe 3 months, maybe 6 months. So that's not a total number, but I wanted to make sure that I thought I heard you say 23. So I wanted to clarify the number 23.
Well, and thank you for that. And I might need to read up or have more conversations on this, because if that is therapeutic foster homes, is there just one for, you know, caseloads, period? Did that change in the new contracts?
Yes. So the number now is 25, and sometimes you can have up to 30 if you have siblings, but the number currently is 25. Starting July 1, we want that caseload to be really 12 to 15 children. And again, the 8 is if that entire all the families you were serving were receiving therapeutic family foster homes, you'd need to consider really being more towards 8, if that makes sense.
Is there still the sibling exemption, or?
Yes. Yes, there can be an exception for siblings.
Will that be relatively the same? I mean, if we're lowering the 23 down to 15 per se, what would the sibling exemption be?
Yeah, I don't know that there's a precise formula for that. I mean, certainly if you're serving 4 families that have 3, and that's 12, and then you might meet a family that has 5 children, so it's a sibling set of 5. You might pop up to 16 or 17. I think it really depends on a number of factors, including where those families are in their path to permanency. If you happen to know that you might be having a couple of finalized adoptions, you know, next month, like for example, in November, then I think supervisors and the organizations look at those complexities and make decisions about anticipating the trajectory of a caseload. That's also within guidelines of Council on Accreditation, is to anticipate closures or ending a service with a family.
Thank you, Deputy Secretary, and thank you, Madam Chair. I'm happy to see that in writing and part of the new contracts.
Okay, Tanya, we have another question for you, and then I have a question for you.
Thank you, Tanya. While you're up there, so one of the stumbling blocks with getting SOL out of committee is the fiscal note. And I would really like to be able to talk to the department, set up an appointment for us to talk about that fiscal note and how it is really not, part of it isn't even relevant to SOL. It's relevant to, okay, if we allow SOL kids to be able to take this money with them, then we have to allow adoptive families to have this same money, which now that is making the fiscal note large with SOL. So I'd like to talk to the department about this if we could before we have final action on the bill.
Yes, we'd be happy to do that.
Thank you.
So I have a couple quick questions, and I assume that you can probably take care of them. I meant to ask the secretary when she was talking, but the first one is the easiest one. I seem to have heard that on the PRTF waiting list that foster children are prioritized. Is that right?
Don't know the answer to that
Okay.
currently. If they're prioritized, my understanding is they're prioritized on need, but we can get back to you on that question.
They're prioritized by need.
For a psychiatric residential treatment facility admission,
Mm-hmm.
But I can get back to you.
Okay. Yeah, I'd appreciate finding that out. And then you've mentioned several times the foster homes, the that for therapeutic. Thank you. Therapeutic foster homes. We put some major bucks in that last year, and I just wondered if where are we at? Are we amping up the number of them? Are we training them? Are they already online?
Yeah, thank you. So, therapeutic family foster homes, an additional $6 million was provided so that we could build capacity. As part of that, the agency issued a request for proposal for proposals to really build that capacity. We're in the process of reviewing those RFPs, and we would hope to be able to announce awards soon. So, about half of that total would be for any agency who submitted a proposal and that we would award. So we'll hear what they want to do. We're also using a percentage of that to look at a statewide curriculum, and we're also looking at other ways to use those dollars in a statewide way to support therapeutic family foster homes capacity building. We should have information soon on ideas and ways that we want to increase therapeutic family foster homes. Currently, we don't have more than we have had in the past. We maintain about 15 to 20, and we know we want to build from that.
You have a goal?
My goal has always been 25 in the first year, and we're in year 2. So I probably at one time had wished for 35 or 40. I'm excited about these additional resources that we know from families and communities that they're saying they need a little bit of help to build that capacity and provide those additional supports. So I'm hopeful that additional supports and approaches for this can help increase the number.
Okay, great. Okay, I don't have any more questions. Anybody else here? Okay, Senator Faustido.
Thank you, Madam Chair. And I know. Tanya, thank you. So, I know over the years we talked about children that come into the foster care system. They might live in Sedgwick County, but then there's no, homes there that can take them at certain times. So then they might be in a home in Johnson County, let's say. So how are we doing on keeping the children though in the same area from where they originally lived?
I think it's been a while since we have run data to look at for those who are in licensed family foster homes. If they are within mile radius or home or contiguous county, I don't have recent data on the percentage of that. So we could look at getting that data.
Madam Chair, I'd appreciate that because at one time we talked about children and their education piece. And so we know if a child from Sedgwick County is over in Johnson County, they're not enrolled in that school district. And I know, Madam Chair, we had legislation at one time that children, though, who were moving from county to county could in fact use the address to be enrolled, the address of a local DCF office, etc. Or Senator Beverly Gossett, you've got me saying etc. a lot. I want you to know. and so, but yeah, I would just, we talked about keeping children, in their home area, if we could. So I'd appreciate that information. Thank you.
Sure, and that's also a priority that we balance with all of the placement needs, and there is federal guidance around the Every Student Succeeds Act that actually puts procedures in place that there's an expectation that a child attend the same school as from where they were removed, and relative to if they need to change grades or go from an elementary to a middle. But so that's a standard and a success factor that we look for, is that children stay in the same school. And local education agencies and local case management and DCF agencies have processes around the best interest decision around the same school. So around education, there are policies and procedures in place for the same school, not even the same district, the same school.
Does that also include when they are when they have a foster care in a different city? Because I have heard that they are transporting them for a lot of miles to make sure that they stay in the same school.
Sure, it could. I mean, the idea around the best interest decision about education in the same school is that um, those folks that are serving that student and serving the family get together to talk about what is really the best interest decision, given the case plan goal, given balancing the decisions about, is it the best interest to be with a relative or to be in a placement that otherwise meets the needs of the child, balanced with where they at in the school year, where are they at in their educational needs and their educational achievement. So it is a balance, and that's
Well, I would add that there's a balance with putting a child in a car for 2 hours with a stranger. So, Senator Gossage.
Another bill that we are taking final action on in the Senate Public Welfare, Health and Welfare Committee is the Social Worker Compact. And I just wondered if if anybody would like to weigh in on positive, your concerns. Are you in favor? That would be helpful. I had not, I see from a couple of people. Anyone? Okay. Thank you. Thank you, Madam Chair.
Representative Humphreys.
Thank you. So just one more question. And this has to do with Chairwoman, you brought this up earlier about doctors or dentists who are mandated reporters. And I'm just curious, I don't know that there's something to do about it, but I just feel the need to explain what happened to one of my constituents who was had a relative who was in the medical field, and they felt like there was a child that they needed to report to the hotline, and they did, and there was some investigation done, and then somehow the parent of that child just went wild on social media and for a time period ruined this medical practitioner's practice. They were getting emails from all over the country on, this person, reported me as an abuser and this is ridiculous. And so have you had that happen? I think I reached out and tried to get some information or what we could do to help. But, I'm curious if there's any thoughts or solution or what we could have done or should have done, or, how do they, I'm not sure how that person knew that it was their medical provider that was the one that mandated reporting. I'm not sure if anyone has any information on what, and maybe that's only happened once in the whole state this year, but
I also had a case but it was not a medical, it was a therapist. Yeah. Tanya, do you want to address that?
Sure. And, I can perhaps just address some generalities.
Yes, sure, of course.
Reporter information is confidential. There are times when a reporter may also be sharing with a family that I will make a call. I need to make a call. How do you feel about me making a call? So there are some mandated reporters who have that style or opportunity for relationship with the family they're serving. There could be times, given the nature of what the worry is, that you might be able to figure out when and where and who might know about that. It's difficult. We keep information. DCF keeps that information confidential. How a parent or a caregiver or someone involved as a collateral contact or someone that we're speaking to about that investigation might come to know or think they know who a reporter is. I don't know how that always happens, but DCF keeps that information confidential, and reporter information is confidential by state law.
Yeah. Okay. I know there's no great answer, but I appreciate you addressing it and everyone kind of understanding. Thank you.
Okay, anything else? Okay, before I adjourn, I just want to remind everyone the Child Welfare Summit is April 15th and 16th. I believe the all of the openings to be there in person have been filled. It was limited for the attendance. It's also limited to attend via Zoom, and but you do have to register for that. So if I think there's still openings in that, and so be sure and register. I just don't want you to think that you're going to hop on and watch it and not be able to. I'll get you that link. Okay, we're adjourned.